到善長嘅一點心意去俾我哋石硤尾村有需要嘅人，而無端嘅指責，甚至我都有幾次捐贈口罩啊、捐贈物資嘅善長嚟到現場去派發，都會俾一啲好心人去指罵。咁變咗其實近呢1-2個星期咧，都已經再冇善長嚟到去捐贈啦。咁頭先所講啦，我都維持咗接近2個月上門派口罩。咁而喺房署或者所謂新樓村物管嘅立場，佢哋嘅態度，佢哋咧就唔係太想，甚至唔好我入口罩入信箱。咁我自然洗樓即係家訪逐戶派。我個諗法就係都係喎，咁其實我每晚每次都要提早2日申請，咁啊即係我基本上1個禮拜每一日都要申請，跟住收集街坊嘅 request， 跟住檢查要包裝，又要送上門，又要申請，即係一個無限 loop 嘅地獄嚟嘅。咁啊好啦，我嗰邊都40幾年樓齡信箱，其實都有啲係鎖唔到啊，有啲就唔中意閂信箱咁樣，都好容易人偷到啲信件。如果我擺口罩，俾人知我定期入口罩嘅信箱，實偷你啦，仲值錢過黃金基本上。OK， 咁好啦，口罩嘅信箱實偷你啦，仲值錢過黃金基本上。OK， 咁好啦。咁點佢哋想我唔入信箱，而佢哋可以入信箱咧？咁啊，我有到啱喺富昌村富來樓都有一單今日嘅確診個案，係啦。大概嘅內容交俾阿傑仔講一講先。
大概我哋確診嗰個就都係富昌村嗰邊咧，診就我哋11點幾先知嘅，即係我哋比起呢邊嚟講，我哋晏啲先知嘅。咁我哋就即時上去跟啦，咁樣。咁但係咧，我哋嗰邊嘅防處就可以特事特辦，可以。我自己咧都係同阿豪仔面對同一個困境，就係即係派咗1-2個月口罩，但係去到有一個位，即係而家開始少咗人去捐助俾我哋啦。咁所以就變咗就係話我哋未必有多嘅資源可以做得到咁樣。咁加上就係我喺我嘅立場覺得咧，就係呢排如果再去搞咁多呢啲口罩嘅問題咧，第一就係你要啲街坊嘥一個口罩嚟攞嗰袋口罩咧，亦都係一個好反智嘅行為嚟嘅。我哋都要響應，即係一啲醫護人員，大家都講要留喺屋企，唔好周圍出街咁樣。咁所以就暫時都係未必會有一個咁大規模嘅行動去做住先咁樣。咁至於豪仔呢個情況咧，其實我今日啱啱豪仔都講過，佢喺富昌村即係一路跟住石硤尾嘅情況嘅，不過佢未有辦事處。咁我哋見到嘅就係話有唔同嘅政黨啦，都嚟去做好多嘅一啲宣傳工作啦，都嚟派口罩或者係做好多嘢。咁但係咧我見證住咧呢邊嘅房署竟然同豪仔講咧，就係話低調啲，唔好搞咁多嘢咁樣。咁我哋又覺得奇怪啦。咁點解當區區議員你要叫佢低調，但係其他政黨嘅人可以做咁多唔同嘅嘢咧？譬如話入信箱即係入口罩信箱，或者係即係再喺度做好多宣傳咧咁樣。咁呢個都係我哋提出一個好大質疑嘅。究竟係即係多區區議員即係喺呢一個情況底下會俾即係房屋署打壓咧咁樣。咁即係我雖然唔係石硤尾呢區啦，但係見到豪仔咁嘅情況，我覺得都冇辦法，即係一定要去幫佢，因為咁樣俾人打壓，我覺得係非常之唔應該。咁樣，即係不論係即係已經唔係除咗呢邊之外，亦都有其他嘅政黨過嚟去做好多唔同嘅宣傳，咁我都非常之憤怒嘅。咁啊交俾豪仔。佢係咪話特事特辦，所以阿廣可以喺富來入？富昌係啦，富昌就同我哋講就可以特事特辦，因為就可以做好多入口罩嗰啲咁樣。但係我哋嗰邊咧就情況好少少，佢都有同我哋講，我哋都可以做。係咁樣，只不過我哋冇咁多口罩去做呢件事，我哋唔想引起即係街坊個恐慌，或者係即係叫佢哋撲嚟攞個口罩咁樣喺呢個疫情底下罔顧自己嘅安全咁樣，所以我哋就即係未有咁嘅計劃。但係豪仔呢邊咧，佢直頭係叫佢低調唔好做。係啦，因為其實呢邊嘅管理處咧，佢哋晏晝到啦，應該冇記錯點左右啦，佢哋應該安排咗佢哋轄下嘅外判清潔工友啦，就過嚟做清潔嘅。咁但係當時管理處就同我講：哎呀，不如低調啦咁樣。咁佢都說服咗我嘅，我好啦，低調啦。因為我都有同管理處講，喂，我低調啫，你派清潔工友入去，咁你其實都係高調㗎嘛，係咪先？咁其實你防護中心雖然網站係尾3樓42座，
咁但係其實個傳言一路傳緊都係調咗過嚟，即係調轉咗過嚟俾新樓，爭在網站未更新嘅啫。OK， 咁聽完阿富昌嗰邊有咁嘅情況，我都好快收到我呢邊嘅街坊同我講：咦，點解美新樓有人入信箱嘅？即係現任個立法會議員同埋前任議員問我咩事，我真係唔知喎。咁佢話：咦，其實係啱啱都拍咗條片，轉頭再睇下有機會 show 一 show，因為我助手都攞咗部手機，有另一個街坊都願意俾我拍一拍。係啊，咁即係佢要求我好低調，甚至唔好過嚟睇啦，即係驚我可能嚟到會引到呢啲街坊注意到望到我，又問我包圍我，只係覺得我可能會出個 post， 好似我今朝早出42座美山樓咁樣，就可能引起一啲不必要嘅恐慌。OK， 我願意低調，但係某些人咁高調，即日特事特辦論上，而衞生防護中心冇一個好白紙黑字去更正、去糾正嗰個錯誤，去轉做美生。咁而你咁快入咗信箱，我先唔理你有冇申請啦。其實你係咪引起緊另一波恐慌咧？因為其實衛生署都未公佈噶嘛，我其實都唔想公佈㗎。但係我礙於不斷收到街坊啊、網上電話都打嚟係咁問，我都迫於無奈要出個 post 回應下，但係我都要澄清翻，我係經過衛生署打電話口頭通知我係轉嚟美生呢一邊新樓㗎啦，但係咧一路掃發都仲係美山嗰邊嘅。咁我唔知某啲人或者某啲管理處係咩居心，要求我當區嘅議員低調，唔好出現，而某些人好高調，去派清潔人員去俾一啲即係唔係當區嘅區議員去入信箱。雖然你係當區嘅立法會議員去撐腰啦，咁其實都好多打壓，即係幾乎都不外乎係。我新樓呢邊得2個場可以租用借用去搞活動，咁但係佢咧就不斷喺村內某一啲村內唔可以借用、唔可以租用嘅範圍去搞活動、擺 booth 咁樣，都投訴過好多次㗎啦。係啊，佢美亮樓、梁君彥、梁美芬聯合嘅立法會議員嘅辦事，竟然係攞咗嚟喺合約以外做一個石硤尾居民服務協會。哇，係！但係咧，好多石硤尾村嘅街坊應該都心水清㗎啦。你選舉投票，你先會見到芬姐嘅啫。就正如我24號先見到芬姐10分鐘。咁其實你美亮樓同21座，你2個所謂嘅辦事處都美亮佢都會開嘅，但係21座啊芬姐嗰個位咧，其實基本上長期唔開嘅。根本係浪費公帑。咁上個禮拜先開翻，啲街坊就登記選民。
我諗最後打個圓場咧，即係話，即係喺呢件事上面啦，我覺得真係房屋署嗰個做法係好有偏頗嘅，亦都真係唔知會即係或者係叫當區區議員低調呢個講法，我覺得係非常之可恥嘅。呢個第一啦。衛生署都責無旁貸。第二樣嘢就係講衛生署啦，即係一個咁簡單嘅咁低級嘅錯誤，美山樓同美生樓都搞唔清楚，然後要更新，仲要等到夜晚先分，冇一個改正嘅通告去同即係市民講，我覺得呢個係完全接受唔到嘅。係啊，咁樣。咁你而家啱啱豪仔所講嘅就係話，你先一波講美山樓，後一波講美生樓，咁究竟係邊座樓先係啱咧？咁樣，咁你要令到2座樓嘅街坊都覺得好恐慌。其實2次傷害佢由尋晚至到依家都未更新，係第一次對美山樓42座嘅傷害。到你今晚如果真係 confirm 轉咗做美生樓，你係第2次傷害，第3次傷害就係你喺衛生署冇任何資料更新嘅情況之下，最可能口頭通知你，書信來往俾你分姐好乜都好，你自己走嚟入信箱 ，OK， 房署派清潔人員我唔理啦，即係佢都係責任所在嘅啫，可能佢提早清潔或者點啊，whatever唔知，咁但係你包庇縱容、特事特辦俾佢入，就已經係一個恐慌，因為衛生署根本就冇正式通知。呢個都係有冇所謂搞？暫時未有，睇下有冇啲街坊想問下或者記者。街坊都係支持嘅。有冇片啊？有片喺呢度。
入信箱嗰個係未申請？
你唔知道，因為
你話2日前啊嘛。
基本上要2至3個工作天去。
房署應該都有一個特事特辦嘅請求，你可以做嘅。但係問題係佢，我覺得最大嘅問題，佢要當區區議員低調，但係佢可以俾其他人高調去入去做。
因為其實你話俾我知或者即係冇問題嘅，你應該叫我低調，而你去俾人去高調入㗎嘛。可能佢好低調入晒信箱呢，咁但係而家點解搞到咁高調咧？就係不斷有你生流嘅朋友同我講，喂，點解佢入咗信箱嘅？發生咩事啊？有啲就話，喂，發生咗嗰件事，你做咩搞咩？你去邊啊？因為其實我執咗佢太多蘇州市啦，真係枉稱係註冊社工啦。我個人嘅立場覺得，即係石硤尾村呢4年嘅即街坊，大家都身同感受啦，可能嚇。係啊。
佢俾條片睇先啦，俾條片。
夠唔夠歌？
夠。
等先，開光之前。
豪哥俾條入信箱嘅片段大家睇下。
咁啊，因為唔想影到街坊嘅樣，佢就啱啱喺度攞咗出嚟。嗱，賴唔到啦，係咪先？咁啊，有另一條嘅。咁啊，都係因為我拍就睇下啦。有啲流塵，遮住。好，有頭。嗱，咁其實你點啫？因為入呢啲新樓嘅信箱，其實要申請，再喺後邊打開隻閘去入嘅，你根本攝都攝唔到。過往呢2個月都一點啦。你係要求，甚至唔係好想我咁樣入信箱，我都覺得辛苦嘅。我入一棟我要去申請即係入一戶又申請一次，我入100戶都係要申請㗎啦。咁幾乎無限 loop 嘅地獄嚟嘅，真係好老實。接近玩咗2個月啦，上滿呢個玩口罩遊戲，好多區嘅素人啊，甚至同路人嘅區議員都停咗唔玩咁滯啦。點解咧？因為因為其實除此之外啦，咁其二。而家咁嘅情況，有咁多外國嘅港人啦、輸入個案啦，甚至留學生翻嚟，即係唔係話咩，而係呢2個月度啦。我自己初步估計，其實去到4月中咧，都仍然係一個社區嘅爆發期啦。我都出海報都會一講個海報都有少少嘢講噶。咁佢海報我都呼籲街坊4月中之前都盡量唔好點出街啦。咁買餸咪買多1-2餐，即係黑口罩，二嚟又降低一個感染嘅機會。咁但係我唔明點解有啲人就可以特事特辦，但係一嚟就落我閘咯。例如今日我想去管理處有工友嚟進行清潔，我想佢哋集合 briefing 之前呢句鼓勵嘅説話，送一啲口罩。因為我今朝我都喺美山樓都講咗幾句，同埋送咗啲口罩嘅，我就唔會拉晒橫額一齊戇居居咁樣畢業相咁企喺度嘅。大家睇我 Facebook 就見到㗎啦。咁我影相都無可厚非，因為我都要向我自己嘅居民交代。喂，但係你咁樣，哇嗰度好大聲，冇事，朋友仔嚟㗎，阿明仔，係啊。咁點解我哋會覺得係政治打壓咧？其實過往啦，譬如上一屆啦，咁基本上嘅當區區議員都。你想我嗱，你更正我啊，因為我都唔係落咗區好耐。咁啊上一屆嘅應該當員咧，佢都可以基本上叫做任貼啦啲海報。咁但係呢一屆咧，哇好得意嘅喎，房署咧定咗條新規例喎。我自己石硤尾區或者即咁多區啦，都係得3格海報位。點解我哋會有一個心正連線嘅出現？最多嘅目的，我係。拎up埋傑仔，拎up埋阿 Lawrence 劉大狀咁樣啦，即係為咗爭取多2格，去貼多啲關於民生或者社會究竟發生緊最 update 嘅咩？雖然我哋每逢10日左右就俾人移除咗啲海報，去再要申請一啲
另一批
係啦，另一批去貼，冇問題嘅，因為某黨派、某啲人士、某啲議員，佢哋就永遠攞政府一啲政策，甚至未傾未實行嘅政策，譬如派1萬蚊啊， 乜乜物啊去貼。咁但係其實到最終啲街坊可能揾佢，甚至有啲揾我。咁但係其實譬如1萬蚊，立法會財委會又未傾又未過，立法會傾。咁啊呢個政治打壓咧係非常之嚴重㗎。咁啊講開海報咧，咁啊上星期咁啊前任啊陳生咧就入咗啲抹黑嘅信件，一張 A4 就入咗去石硤尾某一啲街坊信箱啦，大量就入㗎啦。佢就話講起隔離區長沙灣阿李文浩議員就乜乜與乜乜就唔准內進，佢就好婉轉嘅，就話係咪乜乜乜乜之後，佢就話自己係重服務輕政治，咁啊係咪就代表我洗錦豪就非常之認同李文浩議員嘅言論咧？咁啊扣帽子，咁啊識得我嘅皆知道我基本上都唔係好講政治嘅，要講政治就唔止贏你10票，係咪先？人哋傑仔講政治，你都贏咗幾票啊？啲拋離啊，好啦唔講啦，贏多咗啲啦，係啦。跟住佢轉個面就會即係都希望街坊留低佢嘅意見啦、姓名啦、聯絡方法啦，咁就寫好就投入呢個座頭嘅佢嘅專屬信箱，就會唔知佢有冇申請啦。咁但係喺右下角嗰邊咧就會寫明你嘅填寫資料就屬於佢嘅辦事處所有喎。咁啊大家自己評論下啦。
我諗幫阿豪哥補充下啦。係啊，即係其實
喂，等陣先，佢嘅背面寫意見嗰頁咧，佢話自己係有鮮明嘅政治立場，但喺背面想抹黑我、抹黑傑仔、抹黑大眾嘅言論，就話自己係重服務、輕政治。啊，唔知我有冇帶起身咧嗰張嘢？
係啦，我諗差唔多啦，我幫即係總結下啦，即係立法會選舉就嚟到啦，即係好多開始有唔同嘅風聲、唔同嘅消息會嚟啦。咁我都覺得即係有啲人可能都會即係借住呢個疫情，再加埋個選舉，可能會做好多唔同嘅嘢啦咁樣。咁街坊一句啦，留資料嘅時候咧，就盡量即係小心啲啦。同埋要核實個消息啦。如果真係有啲人去出一啲抹黑嘅文宣或者講一啲嘢嘅話，最緊要 fact check， 即係最緊要去即係了事實咁樣，或者去問下唔同嘅人咁樣。咁即係我哋都會覺得即係即係情況啦，即係好多人會借呢個疫情去做好多唔同嘅嘢啦。咁希望大家都即係提高，除咗對即係對個病毒提高警覺之外，亦都對翻一啲個人私隱都提高警覺啦。有時唔好因為一個口罩而失咗。即係一啲私隱俾一啲唔可信嘅
下一代嘅未來咯。
係啦，咁差唔多啦，係咯，差唔多。唔該曬你。阿宇，你邊？
冇嘢，街坊想問係。街坊都係支持。咁啊，最後補充多個問題咧，就第一個可以話部門可以即係一齊
尷尬影你。
我唔識同啲觀眾講嘢喎。咁帶大家遊覽下呢個美生樓啦嚇。咁因為咧，而家美生樓咧就話有一單確診嘅肺炎個案咁樣，係啦。咁咧，與此同時咧，咁啊喺美新樓嘅附近啦，有一位陳國偉議員啊，咁咧就喺度擺街站咧，就派發唔同嘅防疫嘅用品嘅，係啦。
希望大家提高警覺，做好防護措施。
咁就係香港經濟民生聯盟嘅陳國偉，咁啊前區議員嚟㗎嚇。
大家好，我係陳國偉，偉仔。偉仔今日而家用一個咩身份派嘢咧？第一件事係美心樓一位住戶 確診患上新冠肺炎。
咩身份嘅係？
我問清楚啊嘛，因為我見你着住經文聯件衫，係咪為呢個立法會選舉拉票咧？第二個問題係咧，頭先你自己自稱咧，就係話道門係自己打開，可以邊個都入得入信箱嘅。但係據我所知咧，一個屋邨信箱而家新式嘅屋邨信箱咧，後邊係有道門先可以入到信箱嘅。咁究竟係你經過申請就可以入去啦，開嗰道信箱門而入去咧？如果係房署俾你派嘅，即係特事特辦啦。如果你預先申請，即係你一早就知道呢個美新樓係有一個叫做確診個案啦，你唔會有未知噶嘛。問問題直播緊㗎，直播緊㗎，唔緊要，你咪答咯。
我冇講過話道門自己開俾我入嘅。
頭先有記者過嚟訪問你，你親口同佢講㗎。
佢話我係咪入過去派信箱？
係啊，咁你點樣入去信箱啊？係啦。
我入過，我冇門自己開。
咁你點樣可以入到信箱啊？咁？
唔該你咧。
咁你點樣入到信箱啊？你答各位前議員，你點樣入到信箱啊？請你回答。
我唔打算答你啊。
因為你唔特事特辦，你唔敢答，呢啲咪前議員咯，經民聯嘅前議員。你同梁美芬有咩分別啊？
大家好，
你同啊？你唔夠膽回應啊嘛！你連回應都唔夠膽回應啊！你可唔可以喺度街坊啊？答唔到啊！你而家只喺度迴避問題，唔緊要嘅。大家記住，呢個係陳國偉前議員，經民聯嘅代表。唔知而家有個咩社區處啊嘛？唔清楚。但係唔緊要㗎，街坊知道㗎啦。你用魔法又好乜都唔緊要，冇人想知道。淨係知道你自稱入過去，唔知點樣開到道門入到信箱啫。唔得唔緊要㗎，清者自稱你可以唔狡辯唔答㗎，冇問題。多謝你啊！
偉仔第一時間通知大家，
陳國偉係完全
希望大家提高警覺，做好防護措施。我係偉仔陳國偉。有最新嘅消息，偉仔會第一時間通知大家。
咁經過啱啱佢俾我哋睇嗰條片咧，就係佢派嘢嗰陣時咧係打開咗個 locker， 打開咗個信箱嘅。咁按道理佢琴晚先公佈衛生署嗰個係第2棟樓嚟嘅，今日先知道，即係琴晚先知道原來真正確診嘅係呢一棟面前呢一棟，係啦，美新樓係啦。咁但係佢派嘅時候咧。就見到但係如果佢要派口罩咧，係要申請2至3個工作天嘅。佢咧就係即日就知道咗呢單嘢，就可以即時派到個口罩喺佢個信箱度，仲要個唔係鎖埋嘅，係打開咗，有人就打開咗個信箱門口，跟住就咁塞入去嘅，係啦。佢就懷疑緊點解佢哋可以咁突然就可以派到入去咯，係啦，就大概係咁嘅意思。點解佢可以即日派到？跟住見到佢有張 poster 啦，呢個陳國偉啊，佢就派一個 poster 係呢張啦。跟住佢派咗一支嘢，拎埋呢張 poster 下邊仲埋有一支嘢係搓手液嚟嘅，係啦，就係咁樣啦，大概嘅情況。咁佢就答唔到其他區員嘅問題，就派到有口罩入個信箱度啊？點解豪仔就唔派得啊？要低調啲處理咁樣咯。
政府就未有公佈，
大家好，我係陳國偉。
但按道理申請派呢樣嘢咧，係要2至3個工作天嘅。衛生署咧就未公佈嘅時候，佢就已經行動咗啦。啊，呢支嘢唔係我嘅，呢支嘢唔係我飲嘅，我幫人拎嘅。先你拎住啊自己。
大家好，我係陳國偉，偉仔今日收到一個消息，係未來一位住戶。
咁係咯，大概就係咁嘅意思。琴晚10點幾嘅時候，佢哋先知道真正確診嘅係呢一棟。今日下晝咧，佢哋就派咗個口罩入去信箱度，仲要個信箱係影到嗰條片，信箱係打開咗嘅，打開咁派咯，唔係就咁攝入去嘅。我哋要去邊啊？我知嘢飲啊！我拎咗好多嘢，係咯，今日我哋就係咁。 以我嘅理解係咁樣咯，理解。豪仔去咗邊啊？豪仔。豪仔唔見咗。咁係咯，你見到佢哋會派埋嗰個搓手液。
新冠肺炎，偉仔第一時間通知大家，希望大家提高警覺，做好防措施。我係偉仔陳國偉，有最新嘅消息，偉仔會第一時間通知大家。大家好，我係陳國偉，偉仔。偉仔今日收到一個消息，係美心樓一位住戶確診新冠肺炎。偉仔第一時間通知大家，希望大家提高警覺，做好防護措施。我係偉仔陳國偉，有最新嘅消息，偉仔會第一時間通知大家。
搓手液，呢個係小朋友隻手嚟嘅。
大家好，我係陳國偉，偉仔。偉仔今日收到一個消息，係美心樓一位住戶確診患上新冠肺炎。偉仔第一時間通知大家，希望大家
咁豪仔咧唔見咗。
我係偉仔陳國偉，有最新嘅消息。
條片啱啱大家有冇睇到啊？點佢係點樣帶入去線身嗰陣時？
大家好，我係陳國偉，偉仔。偉仔今日收到一個消息。
我就係唔知去咗邊個豪仔。啱啱錄完片之後就唔見咗啦。咁我哋去睇下咯。我唔知豪仔去咗邊。
你哋飛喺嗰陣，
佢冇辦事處，所以就
21座咯，就唔知邊度。
我見到啊，呢度都已經20座，咁再前一棟就係我估。佢未俾條片我嚟睇，佢未俾我哋條片，佢就俾我哋睇咗下。呢個19、20咁21棟。陣間。好。其實我聽到嗰種講。呢個聽到㗎呢個。陣間。Harry 啊，唔係啊，
喺度咯。
阿楊把聲嚟啱啱。
喂，唔係我把聲嚟啱啱。而家依把聲即係我。
呢個係你 hi 啊
hi。
呢個阿楊。
hi，我唔識講嘢，所以俾翻 MK 妹。
跟住呢個係龍仔。
Hello， 龍仔，我淨係負責影相嘅啫，平時。
信箱嗰道門啊，佢係打開嗰道門，lock 卡門。佢俾我哋條片，但係未 share 俾我哋，就俾我哋睇錯，佢走咗啦，豪仔。去邊啊？
睇下呢啲。
咁交俾你。
唔係，我要執嘢。
我拎嘅嘢仲多你。咁我哋而家就睇下呢度有冇違規啦。1.5米點樣度啊？有冇超過4個人？冇。今日唔跑啦，我着嘅鞋唔方便跑啊。有冇人要報料俾我哋知啊？睇下呢度附近咧有冇啲咩突發？有冇人要報料啊？有嘅話，我哋可以趕過去啊。如果冇嘅話，我見到人。咁我見到佢哋都有拎住部相機啦。邊啊我哋？有冇要報料俾我哋知？有冇啲咩突發？有嘅話，歡迎喺下邊 DM 俾我哋知。我揾到嗰棟嘢啦，原來係42座喺呢度啊！佢係一開波確診，以為係呢一座樓，美山樓啊，山頂嘅山。跟住去到琴晚10點幾嘅時候，先知道係第2座確診嘅係叫美新樓，呢個係美山樓。我哋去邊啊？
咩大嘅？
我要
唔知可以講咩？
學習呢一個開 live 啊！
咁你食個 hi，食個 bye。
喂，係。
即係講咩？
講咩？咩朱古力咩樹？
朱古力咩樹？有朱古力樹呢樣嘢嘅咩？
有人鬧你，點解你把聲咁嘈？
唔係我把聲嘈啊！我嘈咗就唔使開 live 啦。
喂，好小氣㗎！
我哋而家
美山
帶大家去睇下，
呢個就係一開始確診個案。
誤會咗。
係咯，被
確診嘅
確診個案就係美山樓，跟住琴日就 confirm 就係喺美新樓。係。
但係佢要知先㗎嘛。
係啊。
未公佈啫。
係啊。
未公佈啫。
佢講琴日知。
琴日知，但係未公佈俾大家知。但係佢哋就事先派個口罩入去咯。如果你要派口罩嘅話，事先2至3個工作天。
我着到點啊？
我着到。
唔係我啊！
你講緊我啊？
佢揾你啊？
係啊。
我好睇嘅咋？
喂，我哋
俾佢發現率咁高添。
我哋陣間轉左
轉咗去邊？
好，我哋睇睇呢度啊，都係美山樓嘅一部分啦，呢度嚇。山閘嗰度。
係啊，等我搞先。你 hold 住。
hold 住。
你熄住呢個。
我熄咗佢。
熄咗佢。跟住我就喐一喐，擺低啲。
開。開咗。都係歪喎。
緊要啦，你拉翻啲 comment 佢啊。
點樣拉？
喂，冇咗 comment。
又冇影我。
點算？
有。唔好意思啊，係。咁啊，而家帶大家睇睇石硤尾村嘅四周圍環境啦嚇。因為其實咧呢一度咧都已經 confirm 咗有唔同嘅確診個案㗎啦，已經。
咩聲？
煮飯嘅。
梁美芬啊，喺呢度啊，梁美芬啊。
哦，係啦，呢個就係立法會議員啊，梁美芬嘅辦事處，梁議員啊，係啦，咁就乜都冇嘅，係。
佢啱啱都有淨係見過10分鐘㗎咋。
即係佢有出現過喺啱啱美生樓嘅。
我唔聽唔清楚佢話，我淨係聽話。
啱啱我聽另一位記者朋友講，佢就透露梁美芬就同埋啱啱嗰個
陳國偉議員，前區議會議員啦，
係陳國偉就係入過美新樓嘅，咁就喺信箱度派嘢，就根據啱啱位記者朋友所講。
居然
好啦，行啦我哋轉下其他位。
你未講完喎？
完啦。
你講完啊？10分鐘啊，可以講住咯。
行啦。
帶大家再睇一睇啦，係啦，即係附近嘅環境。嗱，其實咧，沿途咧有部分嘅市民其實都係冇戴上口罩啊。喺對面街呢度有一個啦嚇，對面街嘅都係唔戴口罩。
你腳嗰行路有聲。
係咩？重得滯啦！
呢度都有個家棟。
哦，嗰度係深水埗嚟嘅，係啊，石硤尾深水埗。
我哋可以行樓梯幫啲，有冇興趣？
係啊，嗱呢度附近咧就係非常著名嘅嘉頓，係啊。
我由中學去到依家都去唔厭。
係啊，嘉頓山。係。
好啊，係啫嘛。
即係喺前面幾百米嘅啫，其實。
爬山。
咁我哋入去石硤尾村嗰啲公園睇下啦嚇。
我仲諗住爬山添。
冇啊。
健康。
係啊。咁啊，根據政府嘅規條啦嚇，所有嘅康樂場啊、啲足球場、遊樂場啊、
麻雀館同埋巴就唔計，同埋 K 房都唔計。
係啦，咁啱啱講嗰啲就應該全部都刪㗎。咁除咗麻雀館嗰啲 K 房都冇嘅，冇明文規定嘅。咁係啦，嗱你睇到啦，足球冇得放大。有。嗱呢個啦，冇晒網㗎啦已經。咁附近咧四周圍咧都係。有啲欄啦，去到圍封咗啊！呢個地方。
籃球框冇框。
係啦。咦？冇得收翻細。籃球框冇框。係，都係帶大家睇睇下。
可唔可以成日影到我啊？你影嗰邊。
喂，你啲 feel 數暴跌。
因為係你哋。
係啊，可能係我男人聲。你又冇戴口罩。
你把聲令人諗住瞓覺。
對唔住咯，新手。
唔係啊，不過都係呢個差唔多啦。
啱啱300幾。球場入邊公廁嗰度好多道友，好啦，等我睇睇先啊。球場 公廁。等我揾揾先嚇。
直行直行。
好咁啊嗱，大家見到啦，即係籃球場都係包括在內嘅，咁就全部都係圍晒封條㗎啦，係啦。
廁所唔好影。
咁就我哋，但係咧嗱，其實你見到咧有好多唔少嗰啲住唔知係咪住呢一區嘅人啦，就其實都已經好明顯多過政府規定嘅嗰個數字喺度聚集緊㗎啦。即係不管佢哋有冇戴口罩都好啦，係啦，大家都睇到啦，係啦，羽毛球場啊，呢啲排球場啊都封晒㗎啦已經。咁我哋都可以見到石硤尾村嘅辦事處啦，都已經有一張咁嘅通告㗎啦，係啦，咁就唔同嘅康樂場所啊、設施啊、自修室啊等等咧，都係全部關閉嘅，咁就直至另行通知咁樣，係啦。哦，有人打籃球喎，我哋睇睇佢啊。咁咧就有人偷雞打籃球嘅。咁啊，呢幾個年青人咧就無懼呢一個疫情啊，咁就希望用健康運動去到抵抗疫情咁樣嘅，係啦，係啦。咁因為其實籃球架咧係冇封到㗎，大家可以見到呢度冇封到，因為其實部分嘅康文署嘅籃球框係封咗㗎啦，但係咧就呢一個咧係冇嘅，係啦，咁就係啦，大家可以咁係啦，佢哋見到我哋影住佢都收斂咗啲啊。好，咁我哋就繼續去其他地方睇下啦嚇。咁就我哋一路帶大家睇睇啦，就繼續去埋深水埗嗰邊啦。講一講啲疫情問題啦，即係啲數字。
有冇嗰部機？緊張先。喺呢部機度咯。
唔係啊。
我覺得呢個
有冇條 link？啲人全部睇緊我哋。
我見到呢度真係好多人冇戴口罩。
但其實呢度真係好多人，係。 642啦已經。咁咧就
確診682
啦已經，係啦。咁而家香港現時咧，其實真係確診嘅人數其實增加到40幾啦，已經。今日係啦，已經數咧去到682嘅，682啦，已經去到。咁啊，其實咧嗰個問題都非常之嚴重，大家咧真係要勤啲洗手啊，戴口罩啦，出街都好冇。咁啊，盡量就避免去人多嘅地方啦。嗱，我哋睇下呢間係深水埗嘅一間連鎖快餐店啦。你都睇到咧，就其實入邊咧都有寫到明係話，即係有遵從到政府嘅建議嘅，有寫住話唔可以多過4個人啦，同埋要有進行適當嘅隔離嘅。收拾唔到嘅。好，我哋夠睇下。好，咁就每一張台都有一個空位出嚟係隔住嘅，咁大家可以睇到啦。其實咧，我哋沿途一路睇咧，真係非常之多市民係冇戴到口罩噶。嗱，即使佢哋坐喺度啦，休息都好啦，即係啊，我哋都建議翻大家盡量都戴翻口罩，會比較安全啲，係啊。口罩其實真係非常之重要啊！好，你揸住，我哋講。
Hello MK 妹，我哋依家係就到深水埗啦。咁前面咧就係嘉頓山嘅入口啦，即係呢度轉彎入去美河樓嗰邊就係嘉頓山嘅入口啦。我哋又到咗深水埗啦，同埋我哋都喺深水埗影咗個 live 嘅。乜報料啊？話俾你知道附近咧有冇啲咩突發啊？哦，嗰度有咩2000蚊？我啱啱先拎住呢支嘢就，交俾你。
哦，好，
俾翻個樣。
喂，係，就係攬翻個正先，因為
我驚人哋到你知道咗你做記者，但係人攬整開啦。
哦，錯嘅。咁啊，啱啱咧講到而家香港咧已經確診人數咧已經喺度680幾宗啦。咁今日咧單係今日就已經有41宗確診個案。咁咧其中咧有34宗咧係有外遊記錄嘅，係啦。咁啊有17個咧其實咧係一個留學生嘅。咁之前都講過啦，話喺酒吧感染嘅人數咧，已經咧係累計62個人㗎啦，已經。所以咧呢一種嘅有好多人聚集嘅場所咧，就大家盡量避免就去啦，係咯，就為咗大家安全起見啦。
南景嗰個係30幾嗰個嘛，30幾，係呢個。
係啦，咁仲有一個咧就係 尋日嘅咁就比較舊嘅新聞啦，就係一個31歲住西九龍總區嘅男警員咧，已經證實確診㗎啦。咁根據
同嗰個深水埗嗰個女警員係冇關。
係啦，根據呢個證據咧，就即係佢自己口頭咧描述就話，佢係同早前嘅確診女警咧係並冇密切嘅接觸嘅，係。
因為佢係深水埗。
已經係第3個確診咗啦，即係喺一個警員入邊。前面呢個係 MK 妹啊，係啊，呢個係 MK 妹係嘛？
佢同你跌咗1分鐘。
呢個係 MK 妹，呢個。
你唔係啩？我唔係阿婆啊。
佢問呢個係咪 MK 妹？
我唔係阿閃啊。
啊？係咁，而家 MK 妹會帶我哋去深水埗遊覽下地頭啊！佢地頭深水埗。咁沿途我哋會經過少少食肆啦，咁我大家一齊去睇下而家即係堂食嘅食肆有冇遵守到香港政府所發落嚟規條啦？我哋
係見到啊，就分開晒。
係啦，咁嗱，乍眼睇其實我哋唔知道有冇相隔嗰個距離，嗰個距離有冇1.5米啦。咁但係就就咁望落去咧，係的確會有1、2張台係做隔離之用嘅，係啊。咁啊，
我冇。
好。
好飽，唔該晒。好飽。
係見到佢哋係用喺張凳咧，係整咗啲墊。
係啊，有啲墊喺度嘅，
係隔住咗一個距離。
哦，呢度啦，你冇喐我呢度有塊。
你見到而家餐廳係用膠板啦，仲有一個阻隔嘅距離。
係有個膠板喺度嘅，咁就應該係可以擋住啲飛沫啦。估進食嘅期間，係啊，都幾聰明嘅一個設計嚟嘅。
你小心 double tick 咧，會影到自己㗎。
自爆咗。
我成日都自爆咗自己。
我都試過。
我試過2次。
我嗰次
3次嚟啦。
一次上得啦。跟住
我喺元朗嗰次自己有食。
係咁咧，嗱，雖然麻雀館咧就唔係喺政府嗰個規條入邊啦，咁但係咧，你見到門都會寫住，咁就請佩戴呢個口罩，請佩戴口罩進場嘅，咁就係啦。食㗎啦，你試多。唔好打我爛。有嘅啦，有嘅，見到大家。
實見到啦，
見到得。
笑咗。
大家見到嘅。
又係冰室。
嗱咁呢一間嘅食肆啦，其實佢都係有進行到隔離嘅，都係睇到。點解可以？
你隻手指有啲唔明文啊？
係啦，咁就
番茄先食咗啦。 飽啊！但係依家飽到不得了，食糖先又食得落。係我知啊，琴日我經過啦。
咁我哋又睇睇呢啲 corner 位嘅呢啲食肆啦，係啦。
喜喜美食。
嗯，係啦。
喜喜有好多間嘅，係啦。佢除咗朗豪坊、深水埗，好似仲有一間嘅，我邊日見過我唔記得咗。
我記得土瓜灣都好似有間喜喜，但唔知有冇聯繫嘅。
喜喜好似唔一樣嘅，
唔一樣嘅，係啦。
當初
都係叫喜喜。
聽嗰個係朗豪坊嗰間。
嗱咁咧，大家可以睇到啦。嗱，呢間文記車仔麵食咁啊，非常之貼心啊！入邊咧有圍板啦，咁圍板之餘咧，其實咧佢係有呢一個保鮮紙啊包住啊，咁我估係方便清潔咁樣啦。咁每一個食客咧隔離咧都會有一張或者兩張凳以上咧去夾嘅，係啦，非常之好啊！文記係啊，我哋啱啱睇咗文記啦，唔好意思啊，而家先睇到，係啦，咁再俾大家睇多次啊，文記啊，文記，咁就嗱呢張台啦，其實都係吉嘅，係啦，呢張台吉㗎啦，咁大家都有唔同嘅，係啦，大家都睇到啦，每一張台都係唔超過4個人嘅。好，嗱sorry 啊，再睇多次啊。咁咧就，如果冇戴口罩嘅人士咧，就嚴禁進入啊，嚴禁點餐等等嘅嚇。好啦，咁我哋繼續兜圈啊，大家，係啦。咁就三哥呢一間係，咁食客咧咁進入呢一間餐廳咧係。係啊，咁啊，店員好細心咁同食客咧去解釋點解嗰張台係唔坐得人嘅。咁因為受到疫情影響啦，咁嗰啲空格位咧就要用作去到隔離之用嘅。係
講咩啊？
跟住你講咩？
冇啊！
我冇啊，你繼續啊！
我尋日就係呢間。
係咪就係呢間？
哦，即係鬧交嗰間。
係鬧交嗰啲。
多謝。
就係咁啱嘅。
係啦，有進行量度體温啦，非常之好啊！
琴日就呢間。
係啦，尋日咧就有啲小插曲發生嘅，就有個女士啦，係啊，有個女士就冇戴口罩，就想進入呢一間餐廳度食嘢嘅，咁但係咧咁但係咧就店員咧就拒絕咗啊，係啦。咁就嗰位女士就喺個門口度就同呢一個店員咧就發生爭執啦、對罵咁樣啦。咁就嗰段片就應該大家都可以好容易，
都有睇。
係啊，好多地方都睇到嘅。如果有興趣可以揾一揾。
第一次有觀眾。
係咯，第一次撞到佢，
係啊，
好似係。係
啊，唔係，即係唔計觀錯，唔計特登過嚟嘅話，咁係咯。咁啱撞到。
唔係啊，我哋之前都有㗎，不過唔記得幾時。
之前咯，油塘咯，油塘。
好，我哋兜埋過去呢邊啦，咁。
都見到啲小攤收晒。
係啊，其實咧，平時呢個時間咧
8點半就收㗎啦。
係咯，其實。
差唔多8點半。
而家幾多點？
係咯。
8點半幾咯，8點7啦。
都好多，其實都根本就冇開到門添啊！其實有啲。嗱，公和係啊，我睇下。
啲嘢食都係排出嚟。
其實係咯，就見到啲嘢食就咁樣攤咗出嚟咯。
衞生標準啦，
唔係太好嘅又真係係啦。
因為而家疫情期間，你啲嘢食都係放出嚟冇任何遮掩啊，咁就比較整污糟啲嘢食啦。同埋見到地下咧都係大攤積，
好細個結婚啦喎，佢
所以都唔係太乾淨。
咁啊，我哋就去睇其他啦，我哋好唔好？呢間都係公和，係咯。
我哋跟住聽調查。
係啦，就公和唔係太衞生啦，頭先我睇到。
係啦。咁啱啱我哋就見到啦，就有幾盤嘢食都係放出嚟路出邊嘅，咁可能嗰個都係去個商店範圍啦。咁但係你放咗嘢食出嚟啦，一盤盤咁放咗出嚟，咁加上而家疫情期間啦，你啲嘢食係冇任何掩啊，冇啲膠瓶去及住啊，咁就比較容易整污糟啲嘢食嘅，同埋佢店鋪出邊啦都係有大攤積水啊，咁就會令到植物較容易受到污染咯。
好啦，繼續講。
OK。
有冇諗過去邊啊？
我幫我攞住支嘢。
好啊，我幫你。
我兜一兜就算我哋好冇？好。我哋咁樣再兜多個圈，兜翻後。
兜去康瑞定係咩啊？
康瑞。
康瑞我識行啦，但係你咁樣喺入邊咧，我唔識行。
我想食甜品係嘛？
我不過都話淨係諗住食甜品。
哦，咁就去嗰間啦。係啦。
唔可以。
我哋食甜品啊嘛。哦，嗰間我就係嗰間。
我行呢度，我唔識行。
哦，我
但我哋記啦。
咁我哋開多1-2分鐘 live 啦。如果冇任何事情嘅話，就熄 live 啦。我哋。 喂，
你行得咁快，
喂，唔該，多謝。係啊，因為有 delay 咧，所以你
打橫過去荔枝角道啊。
哦，明白，唔該，多謝，辛苦。
帶住豬嘴講緊過嚟俾我。
係啊，咁啱啱有個觀眾咧就買咗啲寶礦力俾我哋4個啊，咁係非常感激。佢就一開始就喺啱淡仔出邊就偶遇到個觀眾啦，一個觀眾就喺個 live 度見到我哋，之後就我哋行到呢條路啊，跟住突然佢就跟住個 live 就過咗嚟買咗4支寶礦力俾我哋，即係多謝晒各位觀眾啊！係啊，
跟住佢哋其實唔順路㗎。
係啊，其實佢唔順路㗎喎，佢只係特登過嚟，真係好感激，多謝晒。咁我哋兜出去啦。
如果冇突發嘅話，
係突發我哋就熄 live 啦。唔係要多謝嘅，因為你唔同路啦，但係都買嘢飲俾我哋，所以
仲要急
係咯，仲要急腳過嚟咧，
跟住個 live 去揾我哋。
係咯，點都要多謝翻嘅呢啲。係啊，同埋佢係戴豬嘴咧，唞氣都比較難啊。
我見到佢都喘晒氣。
係啊，咁即係多謝晒呢啲一心嘅好意。喂，多謝，係咯，即係唔使太過特登去買嘢俾我哋嘅，因為係咯，我哋都會買嘢飲俾自己噶啦，咁都係多謝翻啦。
我哋責任嚟啊！呢個
係啊，嗰度係我哋責任嚟噶嘛。記者嘅責任就係報導事實俾大家睇。我明白，啱啱收咗檔過嚟，多謝啊！真係有啲感動。好啦。
哦，我識行啦，但係
咁而家就冇嘢做啦，咁我哋就熄 live 啦。咁最後啦，都係多謝翻各位觀眾去送嘢飲俾我哋啦，多謝大家收睇啦。如果有突發嘅事情，我哋再開 live。拜拜。蛋哥嗰邊有突發。
蛋哥嗰邊。
你睇下。我哋睇睇啊，等荔枝角1號嘅。
咁啊，見到警員啱啱執拾咗一袋嘢啦，咁相信呢應該係賊人留低嘅。喂，有人喺度㗎，幫我改翻個 topic 先。咁啊，而家見到咧，另外一批嘅環頭嘅警員咧嚟到現場接手嘅。咁啊，喺較早嘅時間咧，呢一間嘅藥房咧係俾人偷嘢啦。咁啊，亦都咧係據了解咧，似係打傷咗個職員嘅。咁啊，現場咧漏咗一袋嘢喺度嘅。咁啊，見到咧旺角區嘅警員嚟到現場㗎啦。係啊，呢度資訊中心對面啊。係啊，走甩咗。咁依家咧就將會由翻環頭嘅警員接手呢一單案件㗎啦。咁相信咧架腰咧就會上車走嘅。 咁有一主係交代翻個案情嘅。咁啊，現場咧其實係留低咗一袋嘢，咁唔知係咪啲證物定咩嚟嘅？咁啊，相信咧應該係賊人留低嘅。係啦，咁見到咧其他嘅嚇，你係冇走啊嘛？唔係啊 ，case 嚟㗎 ，case 嚟㗎，偷嘢咩啊嘛？偷嘢打人啊嘛。係啦，咁啊。繼續喺現場大家跟進嘅，咁啊見到啦，依家其實都多名嘅警員喺現場啦，咁樣嘅情況。咁啊見到其實 EU 都應該係即將咧上車走嘅，正常呢啲 case 咧就會交翻俾環頭嘅，咁佢哋要快少少到。咁啊今日見到警員全部都有戴口罩㗎，咁見到咧佢而家警員咧有個袋嘅，咁啊應該係會睇下個袋裏邊有啲咩。咁啊，佢哋又將翻個袋咧擺低。唔唱歌啦，唔好意思啊，唱歌我自己唱俾你聽啦。係啦，咁啊，現場咧就係資訊中心對面啊。咁啊個賊人咧就偷嘢啦，咁啊打傷咗個店員嘅。咁啊，我望一望下另外一邊先。咁未知個賊人係偷咩啦？當然就白車就冇嘅。係啦。咁就見到其實啦，最初較早嘅時間啦，其實都係啱啱開 call 啦，就係話打交偷嘢嘅，係啦。咁啊，唔係打傷咗人啦，傷人同埋偷嘢嘅。咁個賊人咧，相信咧已經係走咗㗎啦。咁啊，但係咧應該就留低咗一啲嘅物品。阿姐，玻璃大嘅咩？咁啊，見到咧其實警員依家咧都係收拾緊一啲物品。咁啊，相信應該係賊人留低嘅。另外一架警車都嚟啦。咁係頭先架 EU 嚟嘅，係咪咧？係啦，頭先架 EU 嚟嘅，吉車咁樣咧，應該係會車翻走嗰啲。咁啊，應該都冇乜話點傷啊，開係咁開咯，傷人偷嘢咯，係啦。但係你見到其實明顯咁樣呢一單其實都好碎料嘅啫，但係好近咁啊，但係都。有好多個警員喺度啦，當然就係啦。咁其實呢啲藥房有啲咩偷咧，我就真係唔知係咪偷朱古力啊。咁現場就係一單嘅商人偷嘢啊。咁但係就見唔到有傷者㗎啦，已經啦，係啦，或者可能好輕傷啦，屌！咁啊，相信咧，而家警員抄緊嗰袋咧，就係賊人留低嘅嘢嚟嘅。可能有啲可能係自己身份證明文件啊，撚嗰啲啦，就可能啦嚇。咁見到警員咧都繼續喺度死抄爛抄嘅。咁最初咧本身咧係西九嘅 EU 咧卡26到場先嘅。咁啊，其後咧依家就連埋環頭嘅警員啦都嚟到現場啦。咁而家現場嘅位置咧，其實就係金城免稅藥莊啊。係咪先？阿姐係食玻璃大嘅咩？咁未知係偷乜嘢啊？睇下可唔可以陣間問我偷咩啦咁樣就。咁啊，琴日優品360嗰個咧偷嘢咧就唔撚柒答㗎。咁啊，佢都係唔撚，我問佢偷咩，佢都唔撚答嘅。嗱咁啊，嗱未知而家偷咩啊？咁其實明顯咧見到咧，道理免化數啦，T 都好撚多嘅警員啊！ 咁啊，卡26應該都走嘅。咁而家見到咧，其實得翻少量嘅警員喺度啊。咁啊，見到啦，U 啦，同埋呢個旺角嘅環口警車都喺度嘅。呢間鋪俾警蘇射過㗎，咁撚激，咁咪血本無歸咯。係啊，呢度係始創中心對面間藥房啊。咁啊，但係相信咧嗰個疑犯啦，已經係逃走咗㗎啦，偷嘢嗰個疑犯。咁啊，而喺旺角區咧偷嘢咧，捉得到最多人咧，我諗暫呢個禮拜啦，捉得最多人偷嘢嘅一間鋪頭咧，應該就信咧係亞皆老街嘅，唔係喺登打士街56號嘅 H&M 啊。平均咧一個禮拜咧係拉1-2件嘅。咁而家咧見到其實得翻啲環口警員喺度跟進嘅啫。係啦，咁啊，賊人就已經逃走咗啦，但係咧嗰個袋咧，嗰個袋啊，我哋見到嗰個袋咧。嗱，個袋咧，其實咧見到咧個袋咧仲喺度嘅，相信係賊人留低嘅。係啊係啊，威威小食對面嗰間H&M 啊。係啦，咁啊，聽日31號啦，咁大家都記得係啦，聽日見啦，咁就我哋都會係全台啦，7個人咧都會喺出邊咧為大家服務嘅。拎嘢跟住俾人被捕係咪？你好，Hello， 歡迎你。H&M 偷嘢咯，其實幾劑都係睇佢啦，喺個沙巴一落啦，直落之後咧入 H&M 轉左咧，其實有間房仔嘅。咁我啲即係我其實睇過幾鑊啦，都警員啦同啲職員咧好似好撚 friend 咁樣啦，已經去到嘅情況。你好啊，你好啊嚇。咁啊，疑犯就走甩咗啦，係啦。咁啊，個袋咧，喂，食玻璃大㗎你？嗱，見到啦，警員咧都繼續就喺度抄，左抄抄右抄抄啊，繼續抄個袋袋先。我哋分開晒嚟行嘅，分開晒嚟行嘅。除咗我係辛苦啲，要即係可能要兔仔幫手喺隔離幫我得閒拎嘢之外，其實都冇乜嘢㗎啦。咁啊，見到警員啦，繼續抄下個袋袋啊！咁啊，相信啊，呢個係賊人留低嘅。好。我都唔知你講乜撚嘢。我咁啱喺度等人啫。機場咩特警啊，黑警就有。 咁啊見到其實個袋啦都仲係佢哋都左抄晒右抄過咁樣樣，唔啦，唔會零探噶啦，係啦。偷咩就真係唔知啊！佢係咁開出嚟就話商人偷嘢咯，咁樣樣，就嘣一聲我衝咗過嚟先。見到個袋咧，佢哋都仲未執走㗎嚇。係啦，呢度係始創中心對面啊，咁啊真係俾水炮車射過嘅藥房。咁啊，而家咧應該係得翻環口警員嘅，卡26咧就走咗㗎啦，咁啊交翻俾啲環口警員做嘅啫。係啦，咁啊大致上其實又拉唔到人，其實冇乜嘢㗎，其實係啦。咁啊，喂，就呢度先啦。咁有啲咩再大單少少先再直播啦，咁樣樣。好啦，咁先啦，拜拜。
啦，咁就雖然今日就冇，我暫時見唔到人話嚟制啦，但係就嗱，咁我而家影下後度咁樣，都冇話有啲就係得嗰度咁多。係啊，聽日先31號啊，係啊，今日係前夕，我哋睇到嗰個字眼係寫住前夕嘅，係啦。如果改漏咗，我再改翻啦嚇。但係今日係8317個月嘅前夕，即係前夕，即係之前嗰日，係啦。咁啊，之前嗰晚啦，係咯。咁所以就都唔算太多嘢喺度啦。咁所以都其實而家即係油尖旺區議會咧，就已經其實喺前一排都喺開會都通過咗一個冇約束力嘅議案啦。咁就係話警察係要得到港鐵嘅要求先至可以清啲花嘅。咁但係當然啦，而家都知道而家啲警察其實就唔係好跟啲規例啊，剩嗰啲嘢嘅。但係都我講翻個少少呢啲知識俾你哋大家啦。係啦，咁就而家就未見人啦。咁我就希望聽日會情況好啲。但係當然我都明白嘅，因為始終真係要面其實我行過，其實喺聯合嗰度嘅時候都見到有啲警察喺度嘅，企咗喺度。所以其實都明白到，其實係如果要出嚟去紀念翻831嘅話，其實係會有壓力嘅。咁所以希望聽日正日就可以會好啲啦。咁我嘅直播都係啊，我都知啊，係啊，要小心啊，真係係啦。哇，琴日我睇一睇對面，係啦，呢邊都就C1 出口嗰度咧就冇咩，暫時就冇咩有任何嘅花啊剩嗰啲嘢嘅。咁就係啦，咁就睇下聽日點樣啦，係啦。但係即係都講聲，而家就咁樣咯，係啦。咁嘅直播係咁多。
is a developing headline involving the U.S.
Today we have Director General Dr. Tedros, Dr. Maria Van Kerkhove, and Dr. Mike Ryan. As usual, we will have an audio file immediately available and transcript a little bit later in the evening or tomorrow. I will give floor to Dr. Tedros for opening remarks. Dr. Tedros, please.
Thank you. Thank you, Tariq. Good morning, good afternoon, and good evening, wherever you are. The COVID-19 pandemic is straining health systems in many countries. The rapidly increasing demand on health facilities and health workers threatens to leave some health systems overstretched and unable to operate effectively. Previous outbreaks have demonstrated that when health systems are overwhelmed, deaths due to vaccine-preventable and treatable conditions increase dramatically. Even though we are in the midst of a crisis, essential health services must continue. Babies are still being born, vaccines must still be delivered, and people still need life-saving treatment for a range of other diseases. WHO has published guidelines to help countries balance the demands of responding directly to COVID-19 while maintaining essential health services. This includes a set of targeted immediate actions to reorganize and maintain access to high-quality essential health services, including routine vaccination, care during pregnancy and childbirth, treatment for infectious and non-communicable diseases and mental health conditions, blood services, and more. That includes ensuring an adequate health workforce to deal with the many health needs other than COVID-19. For example, we're pleased by the 20,000 health workers in the UK who have offered to return to work, and that other countries, such as Russian Federation, are involving medical students and trainees in the response. To help countries manage the surge in COVID-19 cases while maintaining essential services, WHO has also published a detailed practical manual on how to set up and manage treatment centers for COVID-19. The manual covers 3 major interventions. First, how to set up screening and triage at health facilities using a repurposed building or a tent. Second, how to set up community facilities to care for mild patients. And third, how to set up a treatment center by repurposing hospital wards or entire hospitals, or by setting up a new hospital in a tent. The manual covers structural design, infection prevention and control measures, and ventilation systems. This is a life-saving instruction manual to deal with the surge of cases that some countries are facing right now. These facilities will also have longer-term benefits for health systems once the current crisis is over. In addition to having facilities for patients, it's also vital that countries have sufficient supplies of diagnostics, protective equipment, and other medical supplies. Ensuring free movement of essential health products is vital for saving lives and curbing the social and economic impacts of the pandemic. Earlier today, I spoke to trade ministers from the G20 countries about ways to address the chronic shortage of personal protective equipment and other essential medical supplies. We call on countries to work with companies to increase production, ensure the free movement of essential health products, and to ensure equitable distribution of those products based on need. Specific attention should be given to low and middle-income countries in Africa Asia, and Latin America. In addition, WHO is working intensively with several partners to massively increase access to life-saving products, including diagnostics, medical oxygen, ventilators, and more. I understand that many countries are implementing measures that restrict the movement of people. In implementing these measures, it's vital to respect the dignity and welfare of all people. It's also important that governments keep their people informed about the intended duration of measures and to support for older people, refugees, and other vulnerable groups. Governments need to ensure the welfare of people who have lost their income and are in desperate need of food, sanitation, and other essential services. Countries should work hand in hand with communities to build trust and support resilience and mental health. 2 months ago, WHO published the Strategic Preparedness and Response Plan with an initial ask of $675 million to support countries to prepare for and respond to COVID-19. We're very grateful to the many countries and foundations who have contributed. More than $622 million have been received so far. And I would like to use this opportunity to thank King Salman Center of the Kingdom of Saudi Arabia for humanitarian relief for its contribution of $10 million. We continue to be encouraged by the signs of global solidarity to confront and overcome this common threat. The commitment of G20 countries to work together to improve the production and equitable supply of essential products shows that the world is coming together. And coming together is the only option we have. Unity is the only option we have to defeat this virus. Yesterday, I sent a tweet with a single word, humility. Some people asked me why I sent a single word on Twitter saying humility. COVID-19 is reminding us how vulnerable we are, how connected we are, and how dependent we are on each other. In the eye of a storm like COVID, scientific and public health tools are essential, but so are humility and kindness. With solidarity, humility, and asking the best of each other, we can and we will overcome this together. I thank you.
Thank you very much, Mr. Tedros. We will start with questions. I will remind journalists that we can take only one question per person, so we can advance as much as possible. So we will start with the Lausanne Agency. That's a Portuguese-speaking news agency. Can you hear us?
Yes, can you hear me?
Yes, is it Antonio?
Yes, this is Antonio, thank you.
Please go ahead.
Well, I would like to ask a question on the issues of birth and newborn care and breastfeeding. Does the WHO recommend any restrictions on breastfeeding, presence of partners in delivery rooms, and skin-on-skin contact between mother and child because of the pandemic? Because health authorities on countries like my own, Portugal, have banned these practices for women that are infected. Thank you.
Thank you for the question. So we recently published some guidance on clinical management of individuals who have COVID-19, which includes pregnant women and lactating women, breastfeeding women. And it is very important that women are able to feed their children when they're born. There are certain precautions that need to be taken place in terms of contact precautions, but we outline the ways in which that could be done safely.
Thank you very much, Dr. Van Kerkhove. I hope this answers the question. I just been told that there was a little problem at the beginning of the audio for people who were on a Zoom, so please listen to the audio file that we'll send immediately after if you have missed those few first seconds. We go to next question. Do we have Al Jazeera online?
Yes, Al Jazeera here.
Andy, if you can just speak a little bit louder, please go ahead.
Yes, thank you, thank you. I'm Randy Munada with Al Jazeera. So I'd like to ask you regard to the coronavirus pandemic in Indonesia, because as of today, there have been more than 1,400 confirmed cases and 122 deaths in Indonesia, which is the most of any country in Southeast Asia. What needs to be done more by the Indonesian authorities in this case? Thank you.
I'll have a go at the question and maybe the Director General will supplement. While the pandemic is very well developed and escalating in many parts of the world, particularly in Europe and North America, there are countries who are still in the earlier part of the pandemic. It remains to be seen how the pandemic will develop in those countries, but countries with relatively known numbers of cases, and I would count Indonesia in that, have the opportunity to implement a comprehensive strategy focused on containment and on suppression of spread and on strengthening the health system for a likely increase in demand. Regardless of the scenario, it is likely that the number of cases will rise and therefore that the demands on the health system will grow. Therefore, it's really important that the health system is prepared for any increase in cases. At the same time, you have to put pressure on the virus. You have to go after the virus like other countries in the region have shown in Southeast Asia, going after the virus, detecting all cases, testing all suspect cases, isolating cases, identifying contacts, following them and putting them into quarantine or home isolation is the way to go, and matching that with a strong community education and engagement approach. And this needs to be built from the communities up. So an all-of-society, all-of-community approach focused on both containing the virus where you have clusters and small numbers of cases, and where you have efficient or widespread community transmission, to be sure that the health systems in those areas are prepared to deal with what will be a large influx of cases. We believe that is what Indonesia are attempting, and we will do everything to support the government there in doing that.
Thank you very much, Dr. Ryan.
No, thank you. Thank you so much. I just wanted to add to what Mike said. We're working very closely with Indonesia. We had a discussion with the Foreign Minister and then followed with His Excellency the President, and we're aligned with what the response should be, and we will boost our cooperation with regard to the COVID situation with Indonesia. Thank you.
Thank you very much, Dr. Ryan, Dr. Tedros. Next question is Mohammed from Sharq Al-Awsat. Can you hear us, Mohammed?
Yeah, I hear you. My question is that United States allowed the use of chloroquine to treat the coronavirus. Will the chloroquine be effective in the treatment? And does the World Health Organization recommend the use of chloroquine to other governments? Thank you.
Yeah. I will begin, and Maria will give some more technical detail. So that we're clear, there is no proven effective therapeutic or drug against COVID-19. However, there are a number of drugs that have shown promise, either in previous treatment of coronaviruses like MERS or SARS, in the fight against HIV, or in other situations. And there is some preliminary data from non-randomized studies, observational studies, that indicate that some drugs and some drug cocktails may have an impact. Some of those drugs may impact the length of disease, some may impact the severity of disease, and the dosages of those drugs, when they're given to what patient, at what stage of the disease, has not been standardised, and we've never had a comparison group where we've had a randomised approach to treatment with the drug or not treatment with the drug. It is very important that we continue to accelerate the implementation of the randomised controlled trials that have already begun all over the world, including the WHO coordinated Solidarity 1 trial. But there are other large-scale trials underway in various parts of the world. It's also very important that those drugs are very, very needed for the treatment of other diseases, and that we don't see a situation where people who need those drugs for the treatment of other diseases cannot access them because people are just buying them up and using them. Some countries may introduce compassionate use rules which allow physicians to use those drugs in certain situations off-label. That is a matter for national regulatory authorities. We don't encourage that if it leads to widespread use, because it will, in effect, divert drugs away from the diseases that these drugs are used for. And we really want to accelerate the trials that will give us the actual answers that we need. We also need to look at how to scale up the production of those drugs that will prove effective in the clinical trials. Priya?
Thank you very much, Dr. Ran. I will read one question that's from Today News Africa. And the question is that WHO Africa office acknowledged last week that African continent does not have the capacity to produce respirators and ventilate at the moment. What type of support can WHO provide African countries to quickly get the material that it's needed?
As the DG indicated, we've already sent a large number of protective equipment and diagnostic tests to Africa. All countries in Africa can now make the diagnosis of COVID with support from ourselves, from Africa CDC and from others. We've been working with the World Food Programme, the Jack Ma Foundation and Africa CDC to bring PPE into Africa, as well as supplies from stockpile which is based in Dubai. It is not enough. And you're correct, the issue of ventilators is a very difficult issue. One, because ventilators are technologically sophisticated, expensive, difficult to produce and distribute, and require very high levels of training in order to use them properly. There are lots of innovation at the moment in how we can scale up the production of ventilators and even use the ventilators that don't require a patient to be intubated. In other words, how can you support ventilation in a conscious patient? And there are all kinds of interesting solutions emerging on that. The issue is getting those solutions to scale. But the one thing I will say from the perspective of supporting a severely ill patient, oxygen is something we need to discuss, because everybody's talking about ventilators, and that's important. A critically ill person struggling to breathe, a ventilator can be life-saving. But before that happens, what truly is life-saving is the ability of a patient to be given supplemental oxygen in order that the concentration of oxygen in their blood can be kept at a high level. Because that's what patients suffer when they can't breathe properly. The level of oxygen in their blood drops, and you'll hear people talking about oxygen saturation. It means how much oxygen is getting into someone's blood from their lungs. When someone has COVID-19, your lungs struggle to put enough oxygen into your blood. By increasing the concentration of oxygen in the air that someone breathes, you allow more oxygen to reach the blood. Every country in Africa has oxygen, and we need also to focus on getting better distribution of medical oxygen, so patients with moderate severe disease can benefit from that. We will work, and we are working with the World Food Programme. We're working with the UN in New York, and the DG has spoken to the efforts we're making to not only scale up the distribution of such equipment and supplies, but to coordinate that in a way that countries can expect a more smooth service in accessing those vital supplies.
If I could just add something very briefly, this is a very good opportunity to bring more clinicians and medical professionals on board with us who are into our clinical networks. so that they can learn from and share experiences of dealing with COVID-19 patients. Not all countries are overwhelmed right now with patients. Some have very few patients. And it's time right now where we can be sharing experiences, we could be doing trainings that actually look at how patients are treated and what type of care patients who have either moderate, severe, or critical disease could be cared for. So we could bring them on board and join our teleconferences that happen regularly with clinicians all over the world.
Thank you very much, Maria. The next question is Christiana Ulrich from DPA, German news agency. Christiana, can you hear me?
Hello, can you hear me?
Yes, please go ahead.
Yes, this is a question on Austria. The Austrian government has decided to make everyone wear a mask who's going into the shops. I understand from our previous briefings with you that the general public should not wear masks because they are in short supply. What do you say about the new Austrian measures?
Thank you. I'm not specifically aware of a measure in Austria. I would assume that it's aimed at people who potentially have the disease, not passing it to others. In general, WHO recommends that the wearing of a mask by a member of the public is to prevent that individual giving the disease to somebody else. We don't generally recommend the wearing of masks in public by otherwise well individuals because it has been up to now associated with any particular benefit. It does have benefits psychologically, socially, and there are social norms around that, and we don't criticise the wearing of masks and have not done so. But there is no specific evidence to suggest that the wearing of masks by the mass population has any particular benefit. In fact, there's some evidence to suggest the opposite in the misuse or wearing a mask properly or fitting it properly or taking it off and all the other risks that are otherwise associated with that. And there also is the issue that we have a massive global shortage, and where should these masks be and where are the best benefit? Because one can argue that there's a benefit of anything, but where does a given tool have its most benefit? And right now, the people most at risk from this virus are frontline health workers who are exposed to the virus every second of every day. The thought of them not having masks is horrific. So we have to be very careful to apply. But that is not the primary reason why WHO has advised against using masks at a mass population level. But I'll pass to Maria on the technical side. You may have something to add.
Thanks. No, only to reinforce what Mike has said, that our recommendations are for in the community. We don't recommend the use of wearing masks unless you yourself are sick, and as a measure to prevent onward spread from you if you are ill. The masks that we recommend are for people who are at home and who are sick, and for those individuals who are caring for those people who are home that are sick. But as Mike has said, it's important that our frontline workers, who we recommend standard and droplet precautions, have adequate use of PPE, and so that we make sure that we prioritize the use of masks for those who need it most.
Thank you very much. Next question from India, from Banjo Kaur, down to earth. Banjo, can you hear us?
Hi, can you hear me?
Yes, please go ahead.
Dr. Rayan, you must be aware that India, as part of its lockdown, is witnessing unprecedented humanitarian crisis in the form of movement of migrants from one part of the country to other. I do understand that you do not like commenting on individual countries. This is an unprecedented humanitarian crisis. So what would be your advice to our government? And second question, it's not a question, it's just a clarification. None of the situation reports given by WHO says community transmission is happening in any of the countries, while we do know it is happening. So please clarify on that.
Can you just repeat the second part of your question?
I said the situation reports which WHO gives us every day, there are countries and the stage of transmission mentioned against those countries. Against none of the country there is mention of community transmission, while we do know that some countries are witnessing community transmission. So could you please clarify on that?
Yeah, I go back and look at our websites and see if the situation there. I don't believe we've indicated that there is no community transmission in somewhere like India, but we will definitely check that. But going back to, I think, what is the more important part of your question, which is the impact of lockdowns. Movement restrictions in any situation are number one, need to be taken very carefully, and two, obviously, regardless of intent, are very difficult to accept by communities and by others, because people need to move and want to move for family reasons, for economic reasons, and for many other reasons. And it's important that governments communicate openly and transparently with their people as to the reasons why lockdowns or shutdowns or movement restrictions are occurring, because they do impinge on people's freedom of movement. And if people and communities are to offer up that freedom of movement, they do need to understand why it's happening. It's also, and those movement restrictions are regrettable in all situations. Nobody wants to see those happen. But in situations where you have a very, very intense epidemic in one part of a country and in another part of a country it's not so intense, you may have to implement some measure to at least encourage. Sometimes it's advice, sometimes it's strong advice, and sometimes it's a restriction where transport is stopped. Each government has to choose the balance between what is advice to communities and what is in some senses an enforced lockdown. Whatever is chosen, it's really important that communication and acceptance by the community is at the centre of the concern of the government. It is impossible to have an effective restriction of movement without a community on that restriction of movement at all levels. And as the DG said in his speech, when such measures are put in place, it's exceptionally important that those measures are carried out with not only the acceptance, but with the human rights and dignity of the people affected at the centre. Now, that is not always easy, but that is what should be as centre of the objective of the process. And I'm not here speaking specifically about India, I'm speaking about this in general terms. But I think what it does speak to is that these society-wide measures are difficult. They are not easy. And they are hurting people. But the alternative is even worse. And countries, if they're going to be able to move away from this approach of having to lock down and shut down, if we're going to move away from that approach as a means of suppressing the virus, we have got to put in place the public health surveillance, the isolation, the quarantine, the case finding, the detection. We have got to be able to show that we can go the virus, because lockdowns alone will not work. But unfortunately, in some situations right now, they're the only measure that governments can actually take to slow down this virus. And that's unfortunate, but that is the reality. And we need to continually explain the reasons for this to our communities.
Thank you. This is a very important question. Maybe on the first one, based on the transmission in countries, WHO has categorized actually countries into 4. There are countries no cases, what we call the 4 Cs. No cases are a group of countries, and then the second is countries with sporadic cases, and the third is cases, countries with clusters of cases, and the fourth is community transmission. And we have now a number of countries with community transmission, and that's why we have developed a guideline that's tailored to these 4 situations. And please check the website and you will find the 4 Cs and the 4 categories and what should be done based on this. But we have community transmission in many countries, and we have said it many times. And then on the issue of so-called lockdown. Maybe, some countries have already taken measures for physical distancing, closing schools and preventing gatherings, so on. That can buy time. But at the same time, each and every country actually differs. Some countries have a strong social welfare system, and some countries don't. And I'm from Africa, as you know. And I know many people actually have to work every single day to win their daily bread. And governments should take this population into account, okay? If we're closing or if we're limiting movements, what is it going to happen to those people who have to work on a daily basis and have to earn their bread on a daily basis? So each and every country, based on its situation, should answer this question. We're not seeing it as an economic impact on a country, as an average of GDP loss or, the economic repercussions. We have to also see what it means to the individual in the street. And maybe I have said it many times, and I come from a poor family, and I know what it means to always worry about your daily bread. And that has to be taken into account. Because each and every individual matters, and how each and every individual is affected by our actions has to be considered. And that's what we're saying. It's about any country. It's not about India. It's about any country on earth. Even the wealthiest country on earth can have people who need to work for their daily bread. No country is immune. Each and every country has to really make sure that this is taken into account.
Thank you very much. Next question, Associated Press, Jamie.
Hi, can you hear me?
Yes.
Great. Good afternoon. My question has to do with the situation in some European countries. We've seen some signs that countries like Italy and Spain may be sensing that they are reaching peak, and that I believe the UK also mentioned some experts there, or one expert there mentioned that they may be nearing a peak. I'm just wondering if you have any estimates. I know that, Mike, you said on Friday that there's no way to sort of see the end of this, but what about peaking? Do you see any signs of peaking within Europe? Thanks.
If you just look at the extent of transmission in those three countries you mentioned, we wouldn't compare them to Korea or to Japan or to Singapore in terms of their situation. They have much more extensive problems. And then if you compare them to what happened in China, and specifically in Wuhan, which was the most intense epidemic, we did see, rather than basing this on modeling, let's base it on experience, right? We saw what happened in Wuhan after lockdown, and not only did they do that physical distancing, people in their homes, but they continued to look for cases. That's the essential difference. They continued to detect cases and isolate all cases, including mild cases, away from their families. But let's assume they've done that. What we saw over a period of days, and I think you were one of the people who asked the question during the Wuhan event, do you think this is stabilizing? Is it going down? And for a number of days, we said, can't tell, and it went up and down and up and down. So what we're likely to see, if you imagine the lockdowns and the stringent measures that were put in place are now in place for between 2 and 3 weeks in Italy at different levels in different places, we should start to see a stabilization because the cases we see today really reflect exposures 2 weeks ago. So the cases you see today are almost like historical in the way when we're told that we're looking at galaxies through a telescope, that we're seeing light from 1 billion years ago. We're seeing a reality that existed before. When you count your cases on a daily basis in an epidemic, it reflects a reality of transmission and risk 2 weeks before at least. So in that sense, what happened to and what we drop to look at contact has dropped from the 20s to 15 to 12 to 10 to 8 to 4, which means less people have been exposed to that case than would have been 2 weeks ago, which shows people are distancing. For whatever reason, they're distancing. So there are less people at risk from any individual case. Out of the community, they'll expose even less people. And that's how you get ahead of an epidemic. So do we hope that Italy and Spain are nearly there on that? Yes. But the way you stabilize and then move to zero, and I think everyone's talked about the curve and everyone talks about the stabilization. The question is, how do you go down? And going down isn't just about a lockdown and let go. To get down from the numbers, not just stabilize, requires a redoubling of public health efforts to push down. It won't go down by itself. It will be pushed down. And that's what we need countries to focus on. What is the strategy now to put in place the public health measures that will push down the virus after those measures may be released? And then how do we take care of people better in a clinical environment to save more lives? So yes, potentially stabilizing, and it is our fervent hope that that is the case. But we have to now push the virus down, and that will not happen by itself.
And if I could just add to that, what I was going to say, which Mike has just said, is we need to focus on the now. We need to focus on what must be done now to get us out of this. And there is this, I understand completely the desire to want to know when we will reach the peak and when we will see that decline, but that will not happen on its own. These physical distancing measures, these stay-at-home measures have bought us a little bit of time, a little window of time. And that short window has to be used appropriately so that we get systems in place to look for this virus aggressively through testing, through isolation, through finding contacts, through quarantining those contacts, through caring for further patients, because we will still see patients, and many patients are still going to require need, to support other countries that are going to go through this. So the focusing on what we do now is absolutely critical to make sure we use that time wisely, we use that time effectively, so that we do, once we do reach that peak, that we continue to push and suppress that virus down as quickly as possible, but still be ready to find additional cases should they show up. What we've seen in a number of countries in Asia, and that where they've brought this virus down, they've brought transmission down, they're now seeing repeat introductions from outside of their countries. They have not let their guard down. They are still aggressively looking for those cases as they come in and suppressing it so that it doesn't start again. So we need to focus on the now. We need to use our time wisely, and that is to aggressively find this virus and care for our patients.
Thank you very much. Next question is from Nippon TV, Atsuko. Atsuko, can you hear us? Can we try one more time with the Nippon TV? Okay. That's okay. So let's go to Jim from Westwood One. Jim, can you hear us?
Yes, thank you very much. Very good afternoon to you. I would like to clarify a little bit on the chloroquine issue in the U.S. And it should be important to point out that the FDA hasn't approved it for wide prescription by doctors, but only in a hospital setting, and the doctors there can only get it from the national stockpile. But my question is, what exactly was observed with chloroquine or hydroxychloroquine that could lead to the possibility of it being used to treat COVID-19 in a hospital setting? And what do you mean exactly by randomized testing as opposed to non-randomized testing? If you could answer those, I'd appreciate that. Thank you.
Maria will supplement. I mean, there was somewhat people will describe as in vitro evidence, evidence in the lab that the drug was active against the virus, but any number of things are active against viruses. Chlorine is active against viruses, but other things are active against viruses. The question is whether they're safe and effective to put in a human, and whether they will be absorbed and processed in a way that the virus can be attacked and not the body. From the perspective of chloroquine, there were also some small observational studies, one in France, that followed a small number of patients where there was no randomization of those patients and looked at their outcomes. Patients were admitted at different stages of illness, and the outcomes that were really focused on was the length of illness. And the observation that was made was that people, length of illness or length of hospitalization or length of significant symptoms was reduced. No one here is talking about cure. No one here is talking about taking a pill and all of a sudden you recover from COVID. Everyone's looking for therapies that will shorten the disease illness, will prevent people going from moderate to severe, and will prevent those that are critical dying. And drugs act in different ways. Some drugs may actually prevent the virus replicating early in the disease and therefore shorten the length of the illness and reduce the progression to severe disease. Once the disease is very well established and in a later stage of the disease, a lot of the damage that's being caused by the virus has not necessarily been caused by the virus itself, but all of the secondary effects, the inflammation, the drug or the organ failure and other things that happen. So a lot of antiviral therapies are focused on getting a person with the disease treated at an earlier stage of disease. And if you look at a lot of the anti-flu medications like Tamiflu and others, the main benefit that has been found for those, again, has been shortening the course of illness. With regards to randomized control trials, the importance of having a control group is to have a comparison. And then be able to stratify your patients, because if I have a drug and I treat a very severe patient who's of an older age with the drug, and that person dies, does it mean that that drug didn't work? And if I treat a really healthy young person who's got a moderate disease and they recover, does that mean the drug worked? And I don't think any of us need to be rocket scientists to work out that there are many factors that predict recovery or predict death. And what we have to separate and we have to distill out is what is the effect of the drug itself, not the age of the patient, not the condition of the patient, and so many other factors that can affect survival. We've all been through infectious diseases ourselves and we recover. Is that because on one side of the bed or the other? No, we wouldn't assume that that was affecting the outcome of the illness. There are many natural things affecting illness outcome, including the hard work of doctors and nurses in supporting the patient and preventing organ failure and ventilating the patient. So the difficult thing at this moment is distilling out the specific effect of a drug in a complex illness. And that's what we're trying to do with the randomized control trials, and that's why we need so many patients in those trials across many countries, many age groups, genders, many phases of the disease and many levels of severity. And then we can bring out what is the actual effect of the drug on the outcome of the disease.
Only to add that there are a number of clinical trials that are ongoing. Mike has described the French study that I'm aware of as well. But there are a number of clinical trials that are ongoing that look at chloroquine, that look at a number of other therapeutics. And on the one hand, it's incredible to see this acceleration of research and development and this focus on the evaluation of therapeutics for COVID-19 patients, which is building upon a history of other respiratory pathogens that have plagued us. But the challenge is that many of these clinical trials are small in size, which makes it very difficult to draw any conclusions. which is why it is very important that we have these larger trials, these multi-site trials, the Solidarity trial that WHO is running, to be able to have enough cases to be able to get an answer to which drugs work safely.
Thank you very much. We have time for one or two more questions, so I'll try with Bloomberg and Naomi. Naomi, can you hear us?
Hi, yes, I can. Thanks for taking my question. Wanted to ask, we've seen some different approaches to quarantine in China and in European countries, with group quarantine used to good effect in China. Do you think that home quarantine will be as effective anywhere for people who are positive, or would central quarantine be needed in order to have the same success that China had?
Hi. So we get our terms right and we can explain ourselves properly. We tend to use the word isolation for someone who is a case confirmed. We tend to use the word quarantine for someone at risk of being a case, usually a contact. So on that basis, we advise that all suspect cases are tested and all suspect cases are isolated in an appropriate medical facility. I think nobody disagrees with that, where the capacity exists. When we come to contacts, it very much depends on the context and the intensity of the epidemic at any given moment. In low incidence areas where there are sporadic cases or clusters, we advise that all contacts should be quarantined. Ideally, that quarantine should occur in a place other than the home. And for this reason, one, because if that person gets sick, they may already have infected their family. But that's not always possible. So at least quarantining contacts at home with good health advice about not transmitting disease if they become sick, and with regular monitoring of that individual, is an option for countries. It is difficult to do that in the middle of intense transmission, where you might have hundreds of thousands of contacts because you're having thousands of cases a day. It is difficult to deal with that. So home quarantine of contacts is acceptable with appropriate information, education, and more importantly, a very rapid system of getting those people out of their homes if they become sick. I listened to the president of Singapore this morning, and he had a conference call with the Director General, and the clarity of that in Singapore, that ability not only to isolate cases but to rapidly detect illness in the contacts and remove those contacts should they become sick, was a central part of that. And as he said, that wasn't, they're using apps now to do that. They're testing apps, but they didn't do apps in Singapore. They did that with community workers, with public health workers, visiting the houses, checking on people, checking their health status every day and saying, how are you? Have you got a fever? Have you got a cough? And if a contact has developed a cough or a fever, they were taken immediately for testing. So yes, we need the information technology tools. They help. They are not the solution. Right now, we don't have an alternative. We would have considered in the old days boot leather epidemiology. Public health practitioners, doctors, nurses, community workers working with communities to detect cases at community level. And the most likely person to become a case is someone who's been a significant contact of another case. And at the moment, in most parts of the world, due to lockdown, most of the transmission that's actually happening in many countries now is happening in the household, at family level. In some senses, transmission has been taken off streets and pushed back into family units. Now we need to go and look in families to find those people who may be sick and remove them and isolate them in a safe and dignified manner. So that's what I was saying previously about the transition from movement restrictions and shutdowns and stay-at-home orders can only be made if we have in place the means to be able to detect suspect cases, isolate suspect confirmed cases, track contacts, and follow up on the contact health at all times, and then isolate any of those people who become sick themselves.
Thank you very much. As we try to have a variety of different outlets being able to ask questions, we don't have quite often sport outlets, so I will call on Diane from soccer.com. Diane, can you hear us?
Yes, I can hear you. Can you hear me?
Yes, please go ahead.
Hello?
Yes, please go ahead with your question. Diane, let's try one more time. Can you hear us? We were hearing you very, very well.
Yes, I'm sorry. I'm having my phone. Hello, can you hear me now?
Yes, please go ahead.
There is such a discrepancy of information regarding the validity of masks, and I know that you have addressed this, and there's a great deal of fear regarding medical professionals having access to it. But is there any type of qualitative research that can confirm that the masks, wearing a mask prevents the spread for normal transmission in going to the supermarket, in day-to-day activity?
I can start, and perhaps Mike or the DG would like to supplement. So this is an area of very active research. There's a lot of use of masks globally for different diseases, for influenza, for other coronaviruses, for this particular outbreak. But there isn't a lot of quantitative analysis of this. And what we know works, we know that people who are sick and they stay home, that works because that prevents them from spreading the disease to someone else. We know that washing hands works because we know that or using an alcohol spray scrub because that will remove the virus from your hands. We know that physical distancing works because that removes the opportunity to spread that virus from one person to another. We are working with a large group of people across the globe and our IPC specialist networks to look at the use of masks in very
Gabriela Sotomayor to ask her question. Gabriela, please.
Thank you very much. Thank you very much, Tarek, for taking my question. Dr. Tedros, on testing, there are some that I think that they are not listening exactly. I mean, the message, they are not receiving the message. So just to clarify, because some countries are saying that it's useless to test. So in a country, for example, in a country when you have 1,000 confirmed cases and 2,500 suspected cases, how many tests do you have to do? I mean, just to have a number or something, an estimate. Thank you very much.
The positivity rates on tests, the may wish to comment as to whether people are listening or not, but on the specific issue of tests, the positivity of tests or the number of tests, in general, where testing has been done fairly extensively, we've seen somewhere between 3 and 12% of tests being positive. If you get to a point where a tiny percentage of tests are positive, then the danger is you're either looking in the wrong place, reassuring, or you have to be very careful to ensure you can keep up that level of testing. So it's an issue of balancing the use of your test against their value. And again, it's like any detector system. Thing is a detector system. You can turn up and down the sensitivity of that system as the batteries last. So that's the issue. How long will your tests, the available tests, if you know I've got X number of tests available to me over the next month, then how am I going to use those tests over the next month? So countries have been limited by the number of available tests, and that's important. Countries have also had to ration tests according to the intensity of the disease in different parts of the country. So therefore, the return rate or the percentage of confirmed tests will vary. But we would certainly like to see countries testing at the level of 10 negative tests to 1 positive as a general benchmark of them that's doing enough testing to pick up all cases. Now, it can be more or it can be less, depending on the stance. It's not an objective, but you really do want to see a lot more. You would be very, you know you're making a lot of cases if 80 or 90% of the people you test are positive, you are probably missing a lot of cases.
And if I could just add to that, to say that a lot of the challenges that countries are facing, a lot of the argument that comes back is just, well, we just don't have enough. And so just to say what WHO is doing and what countries are doing is they're trying to find tailored diagnostic solutions to their needs, to meet their needs of their countries and the outbreaks that are happening in their country. And that includes a variety of things that we are doing and countries are doing. The first is to increase the capacity of the labs, so the number of labs that can actually conduct that testing. So whether these are national labs or academic labs or private labs, but increasing that number of labs, increasing the number of people that can actually run those tests, finding individuals that can run those tests. The second is increasing the production and availability of tests. There's a huge number of that are on the market right now, thanks to the rapid sharing of sequences, full genome sequencing of this virus in early January. And then the third, we are working very hard to have a tailored support to country based on their needs, based on what they have in their individual countries, whether these are benchtop or manual PCR kits, or whether these are automated PCRs, or whether these are high throughput machines. There's not one single solution to increase your ability to test, but it is important that you continue to do so so that you know where the virus is.
I think it has been said. Just wanted to add, testing is very, very important. I cannot even emphasize it more. There was a meeting of ministers. This was last Thursday, I think, and we had, some of the practices from 4 countries, actually, what they have done. The common factor in 4 countries was the testing. Testing is important to understand the status of an individual, but testing is also important to see what the situation looks like. For instance, from the presentations of the 4 ministers, we saw that when they test, they go back and check those positives, how they got the infection. Some of them be from a church gathering or a religious event, or others could be in a bar or a restaurant, or others could be in a social gathering for some purpose. And then the testing is not about that individual. It becomes about the event that happened and how to really address such events. So the testing doesn't tell you just a story about one person. It's a story about what happened when that person actually acquired the infection. And that helps you to trigger your public health interventions. Take Korea. When it started, the community transmission, it was actually in a religious event. And thousands of people ended up being infected in one gathering. Another important event was, another important lead was in a hospital. So one was the religious event and the other one was a hospital where they saw a very intensive transmission, and how then they mobilized their public health intervention to address not only that, but also other clusters. So without knowing, without testing, it's like moving blindfolded. So testing can help us not only to know the status of individual persons, but to also what's behind it and take public health measures. And that's why we're saying testing is very important. And from testing, you can do the contact tracing. From there, you can also do the isolation. But we fully understand there is community transmission. The health system could be overwhelmed. Even the public health interventions could be very, very, very heavy. But there are ways to tailor our public health interventions, even in such situations. And the isolation may not necessarily be in a hospital or health facility. It could be in a community facility. Many countries have very innovative ways of isolating because their health system was overwhelmed and they had to actually look for community facilities. And then the last resort is when they couldn't do that and when they have a number of cases and when there is community transmission, then some of them resorted into isolation in their home, and separating their bedrooms and separating the utensils they use. But then let's be practical. Okay, you can have your own bedroom or you can have your own this or that to isolate yourself and to take all the precautions you need. But if it's in a developing country, for instance, where I grew up, if it's a one room where there is a big family, like 5 or 7 people in one room, how do you implement that? And then that's why we say we don't have a one-size-fits-all solution. And the solution should really be tailored to the situation of each and every country. So how do you implement isolation in a situation where a single family, a big family, is living in 1 room or 2 rooms and isolation is not possible at all? So that's why we say one-size-fits-all solution cannot happen. And each and every country knows its situation in terms of COVID situation. It knows its own social and other factors, and it knows what solutions it has at hand to have a successful public health solutions. So that's what we're saying. And of course, necessity is the mother of invention, and we expect a solution in every situation from the communities themselves and the government and the country itself, because each and every situation is very unique, and each and every community knows the problems, knows the root cause of the problem, and knows the solution, and it doesn't need any prescription from anyone. The general guidance we give can help you to really get solutions in your own way. The most important thing is how can we trigger the human spirit in unison to address the problem that we are facing each and every community. Thank you.
Thank you very much, Dr. Tedros. With this, we'll conclude today's press conference. We apologize to all those who have not been able to ask the question, but there will be other opportunities. We will have an audio file sent to you in the next hour, and hopefully transcript will be posted tomorrow. Have a nice day and evening wherever you are.
Thank you, Tariq. And
going to the businesses and is in fact.
And see you in our next presser. All the best.
To trust one another, have to be able to count on one another, and those who take advantage of a crisis to turn a profit are going to severe sanctions from society and from the government. We'll have more to say about that tomorrow.
From Maclean's. It's nearly April 1st, and thousands of Canada's smallest businesses are wondering how they're going to pay rent. Their workers are now covered largely by what we've already announced, but the business owners themselves simply just can't take on more debt, even interest-free loans. Is rent relief on the table for them?
We know that the significant part of business expenses are around payroll, and our focus is right now on supporting workers, supporting Canadians so they can stay home, so they can make sure we're doing the things we need to get through this as quickly and as well as we possibly can. Our focus right now is on this wage subsidy of 75% for employers who need it, that give Canadian workers up to $847 a week, depending on what their salary is. These are measures that will make a huge difference in relief for businesses, in relief for workers, in ensuring our capacity to bounce back, to rush back strongly when this is all through. That is our focus right now. But as I've said, these are measures we're doing now. We are always going to look at, are there more things we need to do? Are there other ways that we must help people get through this difficult time? We will continue to listen and work with people to make sure that we're able to come through this as strongly as possible and get out the other side as strongly as possible.
Merci beaucoup. C'est qu'est-ce qui met fin à la conférence de presse d'aujourd'hui.
Merci tout le monde. Bonne journée.
And that's it for today. Thank you.
And that wraps up that.
Just don't know. So we are preparing for the worst case. And that's all we can do at this point. And we're doing a good job. And we're here for you. Thank you.
Thank you so much, Tom. Now, such an honor to bring to you the military leader of this effort. He comes from a family long connected to the U.S. Navy. He is someone we're thinking about right now as one of our saviors, one of the people who led the forces that came to help us in our hour of need. But his day job is Vice Commander of U.S. Fleet Forces. So he has a big job and a lot to think about, but right now his mind, his heart, his soul is focused on New York City, and I'm proud to say he is also a resident of Manhattan and has a family here and understands what we are all going through. And I just want to, on behalf of 8.6 million New Yorkers, my gratitude for your leadership and for all the men and women who serve under your command. An honor to present to you Rear Admiral John Mustin.
Mr. Administrator, Commissioner, thank you for being here today to welcome this great ship. To the officers, the crew, the medical professionals of USNS Comfort, thank you for the vital mission you've undertaken. I'd also like to recognize and thank the many contributors who worked tirelessly behind the scenes to make this day possible. Each of those who helped to fit out and prepare this ship in record time, from the maintenance community, to the dock workers, to the ship's company, to the doctors, to the dredgers, thank you, all of you, for the agility and professionalism that you have all shown over the past few weeks. That focused collective effort will save American lives. Today, I also want to recognize that not all of our nation's heroes wear military uniforms. Especially today, we acknowledge that many wear scrubs. Let us not forget nor fail to recognize that the doctors and nurses across America, those who are treating patients in these unprecedented times, they are all heroes. And like those heroes, the unmistakable white hull and red cross of this great ship have been a welcome sight around the world, standing at the forefront of our humanitarian missions overseas. This ship represents all that is good about the American people, all that is generous, all that is ready, responsive, and resolute. Like her sister ship, the USNS Mercy, was recently moored and is already serving patients in Los Angeles, this great ship will support civil authorities by increasing medical capacity and collaboration for medical assistance. Not treating COVID-19 patients, but acting as a relief valve for other urgent needs, freeing New York's hospitals and our precious medical professionals to focus on this pandemic. So now this great ship will serve and support fellow Americans in this time of need, providing critical surge hospital capacity to America's largest city. As a resident New Yorker myself, I can attest to the invincible spirit of New York. From the ships that she built in World War II, to her unflappable determination following 9/11 and Hurricane Sandy, I have great confidence that New York will weather today's storm as well. This with the support of another great American community, the naval families on board and supporting the crew of the USNS Comfort. Words are incapable of expressing the depth of my gratitude for those on this mission and for the families that are behind. The men and women on board Comfort are mothers, their fathers, their sons, daughters, sisters, and brothers. And while our lives may look drastically different today than they did even a month ago, circumstances for these men and women are no exception. They left their families during this uncertain time in the nation's history knowing that they can make a difference. That is what the U.S. Navy does, and this is an example of Americans helping their fellow men. I know that for our military families, social distancing is not a concept, but rather a frequent reality. And I remain grateful for all that each of them do for our nation and for our communities every single day. As you heard from the administrator, the line this great hospital ship, all 70,000 tons of her, was in New York, was in the wake of 9/11, where she served as a respite and comfort for first responders working around the clock. Today, then, we bring a message to all New Yorkers. Now, your Navy is returned, and we are with you, committed in this fight. Mr. Mayor, every sailor, every Marine, and every civilian on this mission stands proudly, stands ready to serve the people of New York City. We have not yet begun to fight, and we will not give up this ship. Thank you.
Beautifully said, Admiral, and thank you so much. All right, we're going to take questions now from the media, and just please project your voices so I can hear you well. Go ahead. Oh, we have microphones, even better.
Yes, thank you, Mr. Mayor. So what's your message to President Trump after the Comfort docked here to help New York City? And when it came in here to the pier, what was your emotion and what was your reaction?
It's a very emotional moment. I went up on the roof here to watch the Comfort come in, and I had this incredible feeling of peace, actually, that help was finally coming, that we were not alone. And I just have a reverence for the military. I come from a family that had a deep involvement in the military. I have a reverence for the military. Feeling the presence of the United States military here just gave me a sense that things were going to be okay. And just it's such a moving sight. The ship is so impressive. It just looming there in our harbor, you know, was like a beacon of hope. And it really felt that way to me. My message to the president is thank you, and we need more help. And that's not because any of us likes to have to say that, but because it's true. The toughest weeks are ahead. We are bracing ourselves for something we've never seen before in any of our lives. And the federal government, in many ways, is the only force that can help us to reach the level of preparation we need to save every life we can save. So I'm going to keep calling the president, keep appealing to him to get us all the help we need for these really tough weeks. And then again, we will turn around and help everyone else in this country right after. I'll go to this side. Yes.
Mr. Mayor, as you know, normally this time of year we'd be very busy and focused on the state budget in Albany. I just want to ask, I know it's kind of a secondary issue now, but there is a lot getting crafted up there. Do you have any concerns in terms of what you've been hearing of how the city will be affected?
I have real concerns. I have deep concerns because what's being discussed is essentially health care for people who need it. When you know, we can talk about the Medicaid budget, but that's, I think, the wrong way to think about it. What it equals is health care for people who need health care right now and need it more than ever because of the pandemic. I spoke at length last night with Speaker Carl Hastie and Majority Leader Andrea Stewart-Cousins. I let them know that from the perspective of 8.6 million people in New York City, we cannot afford Medicaid cuts, health care cuts at this dire moment. The state must accept the Medicaid funding that was in the third stimulus bill. We need that money to be accepted, and we need to make sure that the health care so many people are depending on is not interrupted. So I understand that the state has a budget challenge. We have a huge budget challenge. I mean, I'm right now in the middle of cutting a huge amount out of this budget for this city right now. But what I will not cut is health care. And I said that the other day. We're going to find some really tough cuts we have to make, but it will never be about health care. It will never be about the fight against COVID-19. So I urge the state, accept the federal money, do not cut Medicaid, not cut health care for New Yorkers who need it. Let's get, okay, well, just keep going back and forth, whoever's at the phone, go ahead.
Can you tell us what the what kind of services the ship will be providing, and how will it be decided
what patients will be going to the ship and which patients will stay at the hospitals?
I'm going to start, and I'll let the Admiral join in, obviously. What I have to explain to everyone, I think it is such a shock to hear this that people are still kind of adjusting to it. The intensive care units in our hospitals used to be a small part of our hospitals. Again, at the beginning of this month, we had about 20,000 working hospital beds in New York City. What we have to do is convert as many as possible, potentially almost all of those traditional hospital beds into ICU beds. We have to make whole hospitals into intensive care units to get through these next weeks. That's how dire, that's how tough this situation is. If you're going to turn a hospital, I mean, think of Bellevue, think of NYU Langone. You go by these huge buildings, they're going to be all ICU if we can bring all the pieces together, the staff and the equipment and everything. Well, what happens to everyone else who doesn't need intensive care? We have to have hospitals for them too. What happens to people who've been infected with COVID-19 but are not at the point where they need intensive care, hopefully on the way to recovery? They need a hospital bed in many cases too, but we can't put them in an intensive care unit, which has to be reserved for those we're trying to save. So what the USNS Comfort allows, and Javits Center and so many other places being developed right now, is the ability to take all those other patients and give them care. And each location will be different, but it will allow us to keep a healthcare system going while we convert the core hospitals into something we've never done. And this is beyond anyone's imagination. I asked the head of our public health, Dr. Mitch Katz, I said, have you ever heard of any place where they had to turn hospitals into all ICU? He said, no, no one's ever come near having to do that in the last 100 years in this country. But because the comfort is here, because of what's at Javits Center, we're going to have the ability to do that and save a lot of lives. Admiral, you want to join in?
Just in terms of the specifics and the mechanics, we've been working very closely with the local healthcare officials to determine what that process looks like. So frankly, we are prepared to receive, and we trust the screening process that is in effect at the Javits Center so that we will receive advance notice so that the ship can prepare to receive the patients. But in terms of what the healthcare providers determine are the best patients for us, those are the ones that we would expect to receive.
How can you take us to the mechanic, this transfer of patients? How are you communicate this to the patients? What kind of situations are these patients experiencing? And are the families going to be able to visit them on board of the Comfort?
All right, I'm going to start, and I'm going to give you the disclaimer right away that all of this is being worked out in real time. So I guarantee you we're not going to have all those questions and all those answers today because we're literally in a wartime situation building it as we go along. Dr. Raul Pereira-Hense, Deputy Mayor, if at any you want to jump in on any of these questions about procedure, please do, or Admiral as well. I think the common sense basic answer is we're going to work out the protocol between all the players, how to get the right patients to the right locations. Again, reserving the hospitals for ICU to the maximum extent possible. Some places will specialize in convalescent COVID-19 patients, meaning patients on the way to recovery, no longer intensive care. Some places will specialize in all sorts of other medical needs that require hospitalization. Because remember, all the folks with heart disease, all the folks with cancer, there's still so many people that will need hospitalization for other things that are not COVID-19. So we're working out those protocols right now. As to things like visitation, I think a fair statement would be the normal rules will not apply. I'm the non-doctor telling all New Yorkers right now. We're going to always try to respect families, but we have to be clear that the normal rules of going to a hospital just aren't going to exist in this kind of war environment, and people should get used to a different set of standards. It will be determined for each location what that is. But there's going to be such urgency dealing with a huge uptick in cases that we can't do all the things we normally do. Admiral, you want to add, or Deputy Mayor? Okay. Deputy Mayor?
Yes, as the Mayor outlined, we have stood up a hospital executive committee, which includes all the public hospitals, the voluntary hospitals, the independent hospitals, and the command from Comfort and Javits. There's a senior mechanism, very complex, in order to allocate who goes where. As the Mayor pointed out, we are prepared to convert as many of the regular beds in all hospitals in the city into ICU beds. Hopefully we'll get the ventilators, so the most severe cases being taken care of there. The visitation piece will require a screening like we're doing for everyone right now. So if there is any risk that a patient that has no COVID-19 that is being taken care of here at the Comfort has a relative that could be potentially infected, of course there will be screening for them not to come in.
You had said that by Saturday you would decide whether or not to close the playgrounds. Why left the playgrounds open when, for example, Hoboken has closed its parks and Bergen County has closed its parks? Why do we not have consistency on that guideline for social distancing?
This is an issue that obviously we're working with the state on, and the states have all been working together, and there is not one uniform standard. That's just the truth. We are very cognizant. Look, 8.6 million people in a very small space. I don't think taking away parks is a great idea unless we have evidence that people are not following the rules in a really substantial way. I've had this conversation daily with our police commissioner. He says overwhelmingly they are seeing compliance. We know warmer weather is coming, not today, but warmer weather is coming. We're going to watch carefully. What I said is this: right now, the police and all our agencies are authorized to use fines. We've given enough warning, enough education. Anyone who, if you, Andrew, were in the park and an officer said, "Sir, you're not practicing social distancing, I need to move," and you said, "I'm not going to move," they're going to say, "Sir, you're about to be given a fine. This is your last chance. And if you don't move or you don't follow the instruction, you're going to get a fine." If we see any basketball courts where there's games going on and we've warned people to stop, we're going to take down the rims. We're going to take out tennis nets. We're going to take out soccer nets, whatever it takes. On the playgrounds, if we see individual playgrounds where there's non-compliance, we can close the playground. If we see it broadly, all the playgrounds will be closed. But to date, based on the sheer facts coming back from the police department, parks department, non-compliance is limited. You will find some instances. I'm sure you will, Andrew. But not enough to tell 8.6 million people they cannot have parks. And that's the balance we're trying to strike.
Thank you, Mr. Mayor. Yesterday we heard the pretty scary numbers from the government. Do you have any particular forecast and scenario for the city? I mean, particular for New York City?
I've been real honest with New Yorkers. At this point, we assume at least half of all New Yorkers will contract disease. Again, consistently we see for 80%, that means, thankfully, a fairly mild experience that they get through okay, recover quickly. But right now, at least 50%, it could be substantially more. We see this horrible increase in the number of deaths. And I've been honest, I think the weeks ahead will be that the worst is not going to be April, but actually in the beginning of May. But no projection is perfect. I guarantee you, and I wish I couldn't, but I guarantee you that April is going to be exceedingly tough. And we have to understand that any projection of things being all okay by Easter, there's just no way that's true for New York City.
This is a question actually for the former Fire Commissioner, Von Essen. Hi, Commissioner. Can I ask you a question here? Hey, welcome back to New York.
Oh, thank you. I never left.
Well, great to have you here now. I'm wondering, you mentioned mortuary logistics. What are you working on right now?
We're also
What's the
taking
current
unprecedented
city
action to
capacity?
increase NHS capacity by dramatically expanding the numbers of beds, key staff, life-saving equipment on the front line, so that we give people the care they need when they need it most. That's why we're instructing people to stay at home so we can protect our NHS and save lives. I can report that through the government's ongoing monitoring and testing programme, as of today, 134,946 people have now been tested for the virus, 112,805 have tested negative, 22,141 have tested positive. Of those who have contracted the virus, 1,408 have, very sadly, died. We express our deepest condolences to the families and friends of those who have passed away. And I think those figures are a powerful reminder to us all of the importance of following the government's guidelines. We must stay at home to protect our NHS and save lives. And I'd like to thank all of those involved on the front line, in particular all of those in the NHS, for their battle against this virus. Amazing doctors, the amazing nurses, all the support staff working day and night. The thousands of other key workers, from our teachers to supermarket workers, to our fantastic diplomatic network, who are all, as a team, working around the clock to get us through this unprecedented coronavirus challenge. This is a united national effort, and the spirit of selflessness shown by so many is an inspiration. I now want to turn to what we've been doing to support British people travelling around the world. Coronavirus hasn't just challenged us at home, it is the greatest global challenge in a generation. And as the countries work to secure their borders and stop the further spread of this deadly virus, we appreciate an unprecedented number of UK travellers are trying to get home. And we're not talking a few hundred or even a few thousands, we're talking about hundreds of thousands of people travelling around the world. So with that in mind, on the 17th of March, we advised people against all non-essential travel around the world. And since the 23rd of March, we've advised that all UK residents who are currently travelling abroad should return home. Hundreds of thousands have already done so. But many travellers haven't yet managed to get back home, from young backpackers to retired couples on cruises. We appreciate the difficult predicament that they find themselves in. We also recognise the anxiety of families here in the UK who are concerned to get their loved ones home. It's a worrying time for all of those who've been affected. And I want to assure them that this government, their government, is working around the clock to support, advise and to help travellers get home. I've spoken to more than 20 foreign ministers around the world in the last week or so to support this effort to keep airports and ports open and to facilitate access to them by British travellers. Over the weekend I spoke to foreign ministers from Australia, New Zealand, India, Brazil and Pakistan. And I also spoke to the Ethiopian Prime Minister, and in all of those cases urged them to work with us to keep commercial routes flying. Given the scale and complexity of this challenge, it inevitably requires a team effort. So the Foreign Office is working with other governments. There's a particular focus on transit hubs, and we're also working with the airlines to keep as many flights running as possible. We've got a lot more to do, but we've already helped hundreds of thousands of Britons get home. The first priority has been to keep as many commercial flights running as we can, and that's based on just purely the scale and the number of people who want to come home. And as a result of those efforts and the cooperation we received from the Spanish government, we've enabled an estimated 150,000 UK nationals to get back from Spain. On other commercial routes that have come under pressure, we work with partner governments and airlines to get back 8,500 UK travellers from Morocco, around 5,000 UK nationals from Cyprus. That gives you a sense of the scale of the challenge and the numbers of British travellers abroad. Now, in circumstances where commercial flights can't operate, we've already chartered flights which proved necessary to return 1,400 UK nationals on flights, for example, from China at the outset of this crisis, and more recently from Peru. We've not faced challenges like this in getting people home from abroad on this scale in recent memory. Airports are closing down or preventing airlines from operating on a commercial basis. Local authorities have placed restrictions on movement that prevent people from getting to the airport. And the critical transit hubs that we rely on for long-haul flights are also shutting down, or in some cases limiting their flights. Some of these restrictions have been done with very little notice, some with no notice at all, which makes it very difficult to respond. So international collaboration is absolutely vital. As I said, it's a team effort, and it involves government working with other governments, but also working with the airlines. So with that in mind, and today announced a new arrangement between the government and airlines to fly home tens of thousands of stranded British travellers where commercial flights are no longer possible. Partner airlines include British Airways, Virgin, EasyJet, Jet2 and Titan, and this list can be expanded. Under the arrangements that we are putting in place, we will target flights from a range of priority countries starting this week. And let me explain a little about how this will work in practice. Where commercial routes remain an option, airlines will be responsible for getting passengers home. That means offering alternative flights at little to no cost where routes have been cancelled. And it means allowing passengers to change tickets, including between carriers. So for those still in those countries, commercial options are still available. Don't wait. Don't run the risk of getting stranded. The airlines are standing by to help you. Please book your tickets as soon as possible. Where commercial flights are no longer running, the government will provide the necessary financial support for special charter flights to bring UK nationals back home. Once special charter flights have been arranged, we will promote them through the government's travel advice and by the British Embassy or High Commission in the relevant country. British travellers who want a seat on those flights will book and pay directly through a dedicated travel management company. We've designated £75 million to support those flights and the airlines in order to keep the cost down and affordable for those seeking to return to the UK. And in these flights, our priority will be the most vulnerable, including the elderly or those with particularly pressing medical needs, and also looking in particular at countries where we've got large numbers of UK tourists struggling to get home. UK travellers, if they haven't already done so, should check the Foreign Office travel advice, and that advice is under constant review, and it can help travellers find out more details about how to access the flights under this arrangement. They should also follow the social media of the UK Embassy or High Commission in the country where they find themselves, so that they can be direct, accurate, real-time information from the local authorities. For any questions that can't be answered in that travel advice, or by the UK embassies or High Commission, we also have our call centre working 24 hours a day, 7 days a week. Now I know it's been difficult to get through for some travellers. Just to give you a sense of the sheer volume, on average we normally receive 1,000 calls a day to that call centre. Last Tuesday we had nearly 15,000, that's on record. So we've boosted our resources, we've redeployed people to assist in the call centre, and we've tripled our capacity. Yesterday the call centre answered 99% of calls and helped thousands of British travellers to get the answers that they need. So for those stranded or for families nervously waiting news and wanting to see their loved ones return home, we're doing everything we can. We've improved our advice and boosted the call centre so travellers get better and swifter information. We've put in place this arrangement with the airlines so that we can reach more British citizens in vulnerable circumstances abroad where commercial flights aren't running. And we're working intensively around the clock with all our partner countries and governments around the world to keep open the airports, the ports and the flights to bring people home. We've not faced an international challenge quite like this before, but together we're going to rise to it. And of course here at home, we can all support our NHS by continuing to follow the guidance to stay at home, protect our NHS and save lives. I think I'll now hand over to Patrick Vallance, who will give a presentation on the latest data, and then we'll take some questions after that. So
Thank you very much. I wanted to share with you some of the information about where we are in this outbreak and some measures that have been taken. And the idea, as we've said repeatedly, is to try and break and slow transmission of the virus, and that's through staying at home and keeping distant. So the first slide shows that actually this has been successful in terms of the behaviour changes, and I want to thank everybody for the way in which everyone is adhering to the measures that have been put in place. This shows the use of transport over time from the end of February through to now, and you can see a dramatic fall off in the use of the London Tube, down to just a few % of what it was back in the end of February, a decrease in bus use, a decrease in national rail, and a decrease also in the use of all motor vehicles. So the measures are in place, they are making a difference, they are decreasing the contact, which is so important to spread the disease, and we're doing a good job at cutting down. Now the reason that's important is because of course it then prevents the number of cases, should reduce the number of cases. Next slide please. So this shows the number of new UK cases, and I'll repeat what I've said before. This is cases that are detected with a positive test, so it's an underestimate of the total number of cases, and it's those cases which have been tested because they've come to hospital. What you can see is there's been an increase in the number of cases since the middle of March through to today. We expect that the measures that are in place that have caused that social distancing, the stay-at-home message, will be reducing the number of cases of transmission in the community and decreasing the number of cases overall. As the cases flatten off, and we shouldn't take too much attention to individual day-to-day variation, we need to look over time and see what's happening, we would expect this in turn to decrease the number of people needing admission to hospital. Next slide, please. This graph shows the total number of people admitted to hospital since the middle of March, which is now 8,000 people with coronavirus. That's gone up pretty much the same amount each day for the last few days. That shows that it's going up not in an increasing amount, but going up in a constant amount, which may suggest that we're already beginning to see some effects through. About half of those cases, slightly under half, are in London. But what you can see in the lower lines on this graph is that we're also seeing cases throughout the UK. So the message, stay at home, protect the NHS and save lives, is true everywhere in the UK. We all need to do this in order to break and slow the transmission of this virus, decrease the number of cases, and in turn, decrease the number of people coming into hospital. What I've said recently is that we expect this to get worse over the next couple of weeks because there's a lag phase in getting the disease and people turning up in hospital. So we would expect to see a continuation of this at least over 2 or 3 weeks, then a stabilisation and a gradual decrease thereafter. The number of hospital admissions, to repeat, has gone up roughly the same amount each day, suggesting that we're not on a fast acceleration at the moment. Next slide, please. All of this is about preventing deaths and preventing the NHS becoming overwhelmed in the intensive care units with ventilators. And on this graph, it tracks the deaths that have occurred globally across some of the countries, not all of the countries obviously, and it shows that there is a pattern of increasing deaths which you expect to reach a plateau, to come down eventually. And you can see in the UK here, which is in the purple line, we're tracking roughly along the same path as France. I've said before, we're behind Italy in terms of the curve. You can see that Spain has a higher number than Italy at the moment in terms of its trajectory, not in terms of the total number, but the direction in which it's going. The UK is tracking alongside France in this. The measures we're taking will stop the transmission, delay the transmission, reduce the number of cases, reduce the number of people becoming infected in the community, reduce the number of people, therefore, that need to go onto ventilators, and therefore reduce the number of people also that might die or will die from this infection. So I want to thank all of the people in the NHS who are working unbelievably hard at the front line to look after this. What we can do, what all of us can do, is make sure that we heed the advice to stay at home, to reduce those contacts so that we ultimately decrease the number of people who are going to be seriously ill or die from this infection.
Thank you very much, Patrick. And I think we'll turn to questions now. Is Laura Kunsberg there?
Thank you, Foreign Secretary. First off, Sir Patrick, based on what we know now, are the restrictions working, and could we avoid the NHS being overwhelmed if the trajectory continues like this? And Foreign Secretary, you're asking a huge amount of the public. Is it the government's view that people need to be willing to follow these restrictions for as long as 6 months, if that's what it takes?
The trajectory, what we know is that the measures that have been taken are having a very big effect on contacts. And I showed you the data on transport. You can see dramatic reductions in the amount of transport being used. You see dramatic reductions in footfall. We know, of course, that things like restaurants and pubs, which are places where people aggregate, have been closed. So we are seeing a big change in contacts. That is predicted to have a very significant effect on the so-called R. The R value is the number of people on average infected by one infected person. And the idea is to get that number below 1, at which point the epidemic stops and starts to go down. On the basis of the contacts, you would expect that R value now, in terms of the early phases of transmission in the community, to be coming down or below 1, so that we think that that has had the effect that's desired. That takes 2 or 3 weeks to feed through into the number of people who might be appearing in hospital, a little longer in terms of those who are seriously ill or those, of course, that might die. So we expect to see a lag phase before you really see these curves changing. I'll also make a comment about the duration. It's important that we do this now to get the numbers below NHS ICU capacity. That is the absolute priority at the moment. Once that is achieved, once we know that we've got this curve below the ICU capacity and stable, then of course it's time to start asking the question which is being asked across the world at the moment: how do we release those measures and match this going forward? So I think it's premature to put a time, an absolute time, on how long it goes on for. We need to do phase 1, and then we need to think about how we release these in the right way and at the right approach in order to be able to allow the curve to stay below the ICU capacity.
And I think the only thing, Laura, that I'd add is that obviously the more members of the public, as they're doing increasingly, follow this guide, the quicker we'll be able to get into a position where we review whether and how there is any easing of those restrictions. Beth Rigby from Sky.
Thank you. A question first for Sir Patrick. On Friday, the NHS chief said there were 6,200 coronavirus patients in hospital. Today, he said it was 9,000. That's nearly 1,000 new patients a day. Do you think those numbers will accelerate over the next 2 to 3 weeks? And at what stage at the moment do you think the NHS could hit capacity? And then just a quick question for the Foreign Secretary, please. Germany's testing 70,000 people a day. Countries like South Korea are doing mass testing and contact tracing to try and control the spread of coronavirus. Our target is 25,000 tests a day. Is that because you think that number is optimal, or rather is it that we can't get our hands on the equipment because other countries have been faster out of the blocks?
To answer the question about the numbers, so 6,000 to 9,000, roughly 1,000 a day going up in that measure. That's not an acceleration, it's important, and it tells you that actually this is a bit more stable than it has been. I expect that number to continue. I expect the number of people coming every day to be about that. It may go up a little bit. And then in 2 or 3 weeks, you would expect that to stabilise and then to start to slow down a bit. But it's important, that's not a rapidly acceleration number. It's an important number. It's a very difficult number to deal with. And it's a number that the NHS staff are clearly coping with in terms of what they're doing at the moment. And the numbers as projected are designed, as the Chief Medical Officer has said, to keep this below the ICU capacity. You can't promise, and I certainly wouldn't promise, that every single ICU is never going to breach its number, because that happens every winter. But the aim is to try and keep that below across the country, and that's what we're shooting for. That's what the numbers suggest we should achieve there or thereabouts, and that's what we need to keep striving for, and it's why it's so important that we continue to stop the transmission in the community, because that keeps the numbers down going into that critical stage.
Beth, all I'd add is that we're operating on multiple fronts to increase the testing. That includes purchasing more tests. It also means the progress we've been making bringing former NHS staff back into the workforce. Or we want to scale that up as swiftly as possible. It's got to be reliable. I think it was the Chief Medical Officer that said one thing worse than no test is a bad test. So we've got to do this in a safe way. As of this morning, over 900 NHS frontline staff have been tested as part of our new testing scheme, and we'll be rapidly expanding that. Andy Bell from Channel 5.
Thank you. Question for the Foreign Secretary. First of all, do you worry that in some parts of the country police forces are interpreting the instructions from government, shall we say, overzealously and maybe encroaching a little bit too much on the way people maybe want to exercise, take their 1 piece of exercise a day, for instance. Question for Dr. Doyle. As a health service professional, are you concerned that we're still seeing lots of examples on social media of people in the front line of the NHS who feel that they simply don't have the correct PPE that they should have? You might be worried about that. And a final question for Sir Patrick. Are you thinking about adding the symptoms of loss of taste and smell as symptoms that might be pointed towards people having the virus?
Thank you. So on the protective equipment, there has been a huge amount of material delivered to the hospitals and clinics on the front line, 170 million items. And over this weekend is certainly an acknowledgement that people need more of this. Tens of millions of the equivalent, the right equipment has been delivered as well and will continue to be. And getting supplies to the front line is absolutely critical to ensure that people feel safe. It comes alongside a refresh of the guidance to ensure that people are clear what equipment should be used in what circumstances, and that is very active at the moment.
And just on the question asked me about police forces, look, I've got huge admiration for the incredible job all of our emergency services are doing, including the police. Obviously, we need some common sense in the way some of the way that is approached. On the other hand, let's also bear in mind the number one thing, the number one message which the police are rightly trying to convey, in my view, is that people need to follow the guidance, not just to the letter, but also to the spirit. That is the way we tackle this challenge and get through it quicker and as quickly as possible. So I fully support the police in what they're trying to achieve. Patrick.
The symptoms that the Chief Medical Officer has outlined as being the ones that you self-isolate on are persistent new cough and or fever. Loss of taste and smell is something that can happen with other respiratory viruses as well. It does seem to be a feature of this from what people are reporting, and it is something that obviously people should take into account as they think about their symptoms. I think it's really for the Chief Medical Officers to decide at what point, if any, the diagnostic takes place in terms of self-isolation. And those symptoms that we're learning about for this disease are the ones that we're going to get more information on over time. But new persistent cough or fever captures the vast majority of people with this illness.
Gordon Rayner from Telegraph, please.
Thank you, Foreign Secretary. Just to pick up on Andy's question, Lord Sumption, the former Supreme Court Justice, suggested today that some areas of the country are turning into a police state. So will the government give further guidance on what the police should or shouldn't fine people for, so that ordinary members of the public don't get criminalised for shopping for the wrong thing or taking a breather on a park bench? Can I also ask you, as it's your first press conference since the China issue has come up, do you believe, like some of your colleagues apparently do, that China should or will face a reckoning when all this is over? And just lastly, a question for Sir Patrick. Can I ask you, Sir Patrick, how reliable are the official figures on the number of deaths from coronavirus that we're seeing? Downing Street's admitted today that there is a lag in the figures. We're told that some of the figures that are coming out are up to 2 weeks old in some cases. And the ONS is going to be putting out figures tomorrow on how many people have died who aren't in hospital. So have we only been given part of the truth so far?
So just as I said already on the police, of course we back the police doing a very difficult job in unprecedented circumstances. Surely, of course, there needs to be common sense in the way some of that guidance is interpreted, but overall, the overriding message that we want to convey to the British public, and I think the police are rightly trying to convey, is that we need to all be following the letter and the spirit of that guidance, and that's the way we curtail this virus and we get through this challenge as quickly as possible. On China, look, at home here, in terms of tackling this coronavirus crisis and challenge, we need to come together as a team. Internationally, we need to bring as many countries together if we're going to cooperate effectively in tackling this crisis and stopping further waves. We had good cooperation with the Chinese government in terms of repatriating UK nationals for Wuhan, but obviously after the crisis has abated, I think the time to conduct a kind of lessons learned, and I'm sure the World Health Organization will be at the forefront of that.
in answer to the question about deaths, yes, there's a lag in the data. There's a lag in the data. I think the CMO has expressed this before in terms of verifying exactly the time and the cause of death and making sure that all of that side of things is accurate, because you get presumed and then you get confirmed in terms of the virus. So yes, there's a lag in the data, and there'll always be some lag, and I think the NHS, Public Health England, are working very hard to sort of close that gap and make sure that the lag is as short as possible. And ONS, I've been speaking to the national statistician, and the ONS data will pick up also those people who didn't die in hospital but may have died from coronavirus in the community. So that will lead to extra numbers on top of that. Don't expect those to be large, and it's important going forward that we have this reconciliation between all of the numbers.
Ben Glaze from the Daily Mirror.
Thank you, Foreign Secretary. The Daily Mirror is campaigning to give a medal to our brave NHS workers and staff on the front line fighting this virus. Will you back that campaign today?
I think the job they're doing is amazing, inspirational. We've all talked about it from these podiums, and of course deserve all the tributes and all the recognition. And I'm sure we'll want to look very carefully at how we do that once we've got the other side of this crisis. Liz Piper from Reuters.
Hi there. I just wanted to ask a very specific question on antibody testing. When will these tests actually be rolled out, and what the testing regime look like? Will people be able to take them at home? Will there be special stations up where people can do this, and how widely available will they be? And Foreign Secretary, one more question if I may. Since the Prime Minister and Health Secretary have tested positive for coronavirus, can I inquire about your health? How are you feeling?
I'm feeling terrific, thank you very much. The Prime Minister chaired the 9:15 meeting and was full of vigour and giving us the leadership we need, and we're a united cabinet team in terms of getting the country through this crisis. I will, on your technical question on the testing, defer to Yvonne Dole.
Thank you, Secretary of State. So testing is a crucial part of our strategy to deal with this epidemic, and there are a number of strands, and we've heard one mentioned already here, which is the 20,000 tests per day that Public Health England and the NHS are well on the way to meeting by the mid to late April. Now there are a number of others, and you've mentioned one, which is the antibody testing. This at the moment is under investigation. It is a test that is novel. It would be a point of care testing, so it would be done in the place, it could be done, for instance, in the home. And it could be done at scale, but I would come back to the statement that the Chief Medical Officer made, which is this: one thing worse than a no test is a bad test. And this testing needs to be evaluated to make sure it's valid. In other words, it does what it says. And that, at scale, and this would be large numbers, would make sure that we're doing something that's safe and that is actually valid, that it is correct when it is read.
Thank you all very much.
唔好害人哋啲仔女啦。好心啊，啲恨勁乜辛苦，日日打黑色衫，打黑色衫，我哋嘅後生仔。好心啊，啲恨勁天沙林樣，日日爭取打交，爭取打交，又破壞香港。打外打全外打議員打議員打女仔打女仔打死黑警打爛呢個家園啊！死黑警又唔做嘢又唔讀書，死黑警點解我哋唔做嘢？愛人嘅仔女我哋全家仔女啦！死黑警，我冇罪㗎，點解要搞我咧？黑警就係我哋仇人，黑警日日鬧事，黑警壞香港法例，黑警破壞香港法例，黑警就係我哋仇人，黑警日日鬧事。黑警破壞香港法例，黑警破壞香港法例，香港法例，香港法例。